It's 9 o'clock. Could you please stand and join us for the flag salute? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good morning, everyone. Do I have a motion to approve the minutes of Monday, May 19th, 2025 meeting as written?
Make a motion. I'll second.
It's been moved by Abendroth and seconded by McCurry. Any further discussion? All in favor say aye.
Aye.
Motion carries. Motion to approve the Coffee County Jail payroll notice for Jim Cole Jail Corrections Corporal step change promotion, wage classification from 35-4 to 35-5, wage from $22.04 to $22.48, effective 5/20/2025.
Sorry, that should actually 2207. That was a typo. 2207 to 2248.
Okay. Wage from 2207 to 2248, effective 5/20/2025. I'll move.
Second.
Been moved by Thompson, seconded by Barker. Any further discussion? All in favor say aye.
Aye.
Motion carries. Okay, I guess we just will move on to Hospital Administrator Stacy Augustine.
Good morning. How are you guys?
Good. How are you today?
Good. You had a long weekend.
Yeah.
Okay, so we're here today to present our budget, but before we do, there's just a couple of updates that I wanted to provide all of you with. So the first thing, I just wanted to, again, express gratitude and say thank you all for your ongoing support, especially for the HVAC unit that you helped fund, as well as the lab equipment. It was a huge relief to be able to cross that off of our accounts payable, so we greatly appreciate your support there. And also appreciate your support and advocacy for health in our community. I recently went to the Kansas Hospital Association Spring Conference, and unbeknownst to me while I was there, they actually brought up Coffee County Hospital and you all as the commission. They shared the link to the meeting that I came to the last time. And they focused a lot on how we utilize those resources from KHA to explain the position of the hospital, that they were overly complimentary of the commission and the support that we received from all of you. It became very obvious not only from the KHA staff, but also the peers surrounding us in our region, that not everybody has the level of support that we do. So again, I just wanted to publicly thank each of you for your ongoing support and your advocacy for health in our community. It's very important, and not everybody else receives that, so we do appreciate it. As far as updates go, I wanted to touch on the discontinuation of labor and delivery services. As all of you know, that is a service line that is going away at the end of this month. We will discontinue that service effective June 30th. As a review of the reasons behind that, we all know that that service comes with a big financial loss of about $1.3 million for that service line. It's a very expensive service line to keep going, and declining volumes is a big reason for that. Most hospitals, you would need to see anywhere from 250 to 300 deliveries to even break even. We were seeing about 50 deliveries in that service line. More importantly, it just becomes really difficult to maintain staffing as well as high quality care and competency when you're doing so few deliveries every single month. So those are really the big drivers of why we ultimately had to make that decision. But I wanted to also offer to you all what we are doing to make sure that we are still caring for the moms and babies in our community. So we've been working really hard with hospitals in our region to develop some collaborative agreements to continue to provide prenatal care. So I'm really excited and proud to be able to tell all of you that all of the moms and babies in our community will still be able to come to Coffee Health System for all of their prenatal care services, as well as services post-delivery. The only thing we will not be able to provide is obviously that delivery service.
So they'll still be able to use the docks that they're using?
They absolutely will. So the facility that we've worked with, essentially the way that that will work is they will have to go and visit their delivering provider twice throughout their pregnancy, but otherwise all the other care will be delivered by our own physicians, which is really important for a couple of reasons. Number one, we certainly don't want to see moms all of a sudden not getting prenatal care. That is linked with not good outcomes, which is not something we want to see in our community. And if somebody's having to make a drive, they may skip out on that care. So it's important to us that we're still able to offer that. So that's the big reason there. But also, we all know that there's a risk that if a mom leaves our community, delivers their baby there, that they may just transfer their care outside altogether. With the agreements that we have in place with these facilities, post-delivery, they will refer those patients back to us for that postpartum care as well as that newborn care. So hopefully we're going to be able to keep our patients seeking care in our local community following delivery as well. Post-delivery, we also are still able to offer support as far as immunizations with the health department, as well as breastfeeding support and all those other things that are really important post-delivery for moms and babies in our community. We are also in process of providing education for our staff in the emergency department as well as EMS. Again, with no longer having labor and delivery services, there is the potential that we may see more of those types of visits in our emergency department, or our EMS service might be going out on unexpected deliveries or home births, things like that. So we have arranged for some folks to come down and provide some education to our staff so that we are prepared if those emergencies should arise in our community. As far as OB staffing goes, I know that's been a big concern, with the cut of service line, will we be losing any of our employees or anybody as far as jobs go? We didn't have a whole lot of OB nurses to start with. Again, that was another reason for the closure is staffing difficulties. But the way that our structure is, a lot of our OB nurses would also cover our medical surgical floor as well when we didn't have a laboring mom. So all of our OB staff members that are with us have been offered positions in the organization to hopefully retain them. And I do believe that we will be able to retain most of them moving forward. The other topic that I wanted to just give an update on.
Stacey,
Yes.
before you go on, I'm
Sure.
sorry to interrupt,
No, that's
but
fine.
it's been brought to my attention, and I don't know the answer to it.
Sure.
With us laying this down, is it going to affect any grants that you guys write for because we don't have a delivery unit now?
None to my knowledge. There have been a few grants that we have received in the past, but they were very specific to labor and delivery services.
Okay.
So we would no longer be eligible for those that they were truly to fund that service line. I'm not aware of any other grants, Ray, or you, that would be impacted by.
Okay, that's good.
Yes.
Very good.
Yep. The other topic I wanted to touch on, I do watch your commission meetings just to make sure that I'm not missing anything. And I know at your last meeting, or a couple meetings ago, our old clinic building, which is directly across the highway from the hospital, was brought up, as well as the Leroy Medical Center, wanting to know what we're doing with those buildings. Could we get those back on the tax roll? So I just wanted to acknowledge that and let you know that we have added that to the agenda for our next board meeting, which will be next Monday. So our board will discuss that, and we'll bring back a recommendation and some thoughts for all of you on those two buildings moving forward. Next, I do have a packet of information for all of you as we dive into the budget discussion. I know that some of these papers you probably already have in front of you. So this packet of information in the pocket on the left-hand side there, that's the information I'm going to be covering with you today. The rest of the information, I just wanted to provide you all with different resources. I know that healthcare is a completely different beast, and it's a lot to take in. So I printed off some resources for all of you to hopefully help you better understand maybe some nuances of healthcare that you can reference and look at on your own time. And if you ever have any questions, please feel free to reach out. So the first information in your packet is just a list of all of our upcoming board meeting dates in education. Most of you have attended a board meeting or came to our board retreat, so you kind of know the format of our meetings, but we usually try to start with some sort of a presentation or some sort of education. So I wanted to just kind of list that out for all of you. If there's a topic that piques your interest that you'd like to join, feel free. You guys are, of course, welcome anytime to join us at our meetings, even if it's just you're coming in for the presentation and leaving. That's completely okay. Or if you even just want to come for dinner beforehand and leave, that's okay too. We welcome you to come and join us. So that is our upcoming meeting dates, as well as planned education that we have. Next, we'll go ahead and dive into the budget unless there are any questions or updates that you all would like outside of budget before we get into that. Okay. So the next item in your packet, I'm going to try to go in order, is our future capital expenditures. So you can see everything that I have listed there. I did include 2024, and that is highlighted in green just to show what all we were able to take care of last year in 24. You can see there was quite a few items we were able to cross off the list, which were great. In 25, we have a couple of outstanding items. A lot of times when we're talking about future capital expenditures, sometimes we'll refer to it as a wish list. But I want to be very clear that every single item on this list is truly not a wish. It is a necessity. Where the wish piece comes in for us is probably the timeline. There are some items on here that we have continued to push back and push back and push back. And there are some items that we won't be able to push back any longer moving forward. So just looking at 2025, you'll see a traction table. That's a piece of equipment from our rehab department that is in need of replacement. Our foundation has graciously agreed to help fund that, probably with a match of funds there, so hopefully we'll be able to take care of that this year. A Zoll defibrillator for EMS, it's $46,000. We did receive a couple of grants that are going to help us fund that piece of equipment. And then the ambulance at $320,000. The ambulance is about 36 months lead time, so we're looking at about 3 years to be able to get a new ambulance. I do have it slated for 2025. However, we'll order it in 2025, but we actually won't receive it for 3 years, and we won't have to pay for it for 3 years. So I did want to note that. You'll also see that we have it slated for about every other year because we do need to get into a rotation of being able to replace our fleet with all of those ambulances.
How old are your ambulances now, roughly?
Oh, goodness. We have one that is, that's one of the new, we have one that I want to say it was 2012 or even 2013. We have one that's
They've got a lot of miles.
pretty old, yes, and high mileage. And just as a reminder, we have 2 of the big box trucks, and then we have 2 transport vans. That's what our fleet looks like right now.
And you're looking to go to the bigger
We
box
are.
trucks?
We want, a bigger box truck, and preferably we would like to make a switch to diesel. They just last longer. Right now, we don't have diesel trucks.
Is this price, Stacy, is it locked in at $320, or is we gonna have to pay the price in 3
We'll be,
years?
as soon as we sign, we'll be able to lock it in.
Okay.
Mhm.
And so that price would, this price that you're projecting is a price that you can lock in then?
Mhm.
Is that correct?
Yes, correct. You are correct.
Excellent.
Yep. In IT, that's just ongoing. A couple of core servers are needed. We have purchased one. We will purchase a couple more as time goes on. And then down under our facilities, we have 2 items that are fairly urgent: a hot water heater replacement, and this is a large hot water heater. It's not your residential hot water heater. It's quite large.
Right.
That's going to need to be replaced, as well as a sewer line that runs the length of the hospital also needs to be replaced in the near future.
That's under the building or
It
something?
is. There is a crawl space, so that's good. But it does run under the length
Okay.
of the building.
Okay.
Mhm. Yep. The facilities guy keeps trying to get me to go under to take a look at it. One of these days I will. One of these days. I've been on the roof and everywhere else, I just haven't been under the building yet. We'll get there. So moving on away from capital expenditures, we included a profit loss statement. Ray, our CFO, he did a really nice job with this, of laying it out in a pretty easy to understand way. So as a reminder, our fiscal year is a calendar year. I know that the commission's is not. So that does kind of create some confusion at times. But we included the 2020.
Ours is a calendar year.
Your budget?
Yeah, the state is mid-year.
Oh, gotcha.
The
Okay.
county's calendar year.
The county's calendar year. Oh,
I mean, we do our budgets in the middle of the year,
gotcha.
so.
Okay. I apologize.
But like the
I
budget
spoke there.
that you're proposing now would be for 26?
26, correct.
Right.
Yes, moving forward, yep. So we have our 24 numbers, and then we have our budget for 25, because we won't make our 26 budget until 4th quarter of this year. So our request is based off of our 2025 budget that we're working right now. So along the left-hand column there, you will see our 2025 budget. for the full system, and then we broke it down for ambulance and hospital, because those are two separate requests there. So from this profit and loss statement is where we got our numbers that are then plugged into the budget request that you all have received. So looking at our hospital budget, you can see for our total expenditures for 2025, we're looking at about $27,832,276. And then you can see the previous county support that we received along with our projected reimbursements, which leaves us with a variance of about $1,071,530, which is where we get our increase in request of county assistance to total $3,111,025.
Back on the, back on the future capital expenditures.
Yeah.
There's one in there for parking lot resurfacing and sidewalk replacement. And that's been ongoing. I mean, that's been an issue for the last couple of years.
That's one that it continually gets pushed. Yeah, that's been pushed down the line. Yeah.
Right.
Looking at ambulance, we used the same methodology there as far as getting our total expenditures of $1,865,478. And you can see the resources with county support as well as reimbursement, which leaves us with a variance of $83,247, which is where we came up with the request for additional support. Under capital outlay, I did include the $320,000 for ambulance. However, again, we don't need that funding right now. It might be something that we do need assistance and may need to request once it comes time to pay for that new piece of equipment for that ambulance moving forward. So looking at these budget requests, what these requests do not include is capital equipment or capital outlay expenditures that you see on that list. It doesn't include any sort of raises or unexpected expenses. It also doesn't account for potential funding cuts. We don't really know what to expect in the realm of funding cuts. I did in your packet include some things on state and federal legislation and advocacy. At the very top, it looks like this. I apologize, I kind of got out of order there. At the top, I gave you resources to two newsletters that the Kansas Hospital Association puts out every year. It's the Capital Comments newsletter as well as the Federal Advocate newsletter. If you email those two individuals, you can sign up for that, and they will send you those newsletters whenever there are updates available. And it's very specific to hospitals in Kansas. So they do a really nice job of sifting through everything that's going on and providing us just with the information that we need to know that could impact healthcare in our hospitals specifically. I also listed out some of the critical health issues that are at the forefront that we are continuing to monitor and watch to see where those things fall, because every single one of them could potentially impact our facility moving forward. And again, while these are important, they're kind of up in the air. We don't know where things are going to fall. So it's just something that we're watching, and our budget requests are not based on that. I also included in your packet a summary of payments by payer mix. And this is annualized based off of the first 4 months of 2025 with a percentage breakdown. So it shows you our percent in payer mix, which kind of helps us evaluate should any of these items come down from legislation that could impact funding. We can kind of predict that. Medicare, for example, 2% sequestration is a potential, which would end up costing
About
$146,000 in cuts for us. Same thing with Medicaid would end up being about the same. Again, it's all unknown, but something that we're keeping in the back of our mind and, of course, watching very closely so that we can plan should any of those things come down the line in the future. So as all of you know, this is it's a big ask, our request. I don't take it lightly. We are requesting increased funding, and it is significant. We've talked a lot about why we need additional county support. So I'm not going to beat the dead horse there. All of that information, of course, is still included in your packet. You all are aware of what we're up against as far as decrease in funding as well as increase in costs to provide care. But I do want to touch on what we're doing as a health system to improve our financial position, because it is not lost on me that we also have a responsibility to take action to make sure that we are being fiscally responsible with the taxpayers' funds. So there's quite a few things happening behind the scenes at the hospital to make sure that we're doing what we need to do and also to help improve the financial health of the facility. There's two ways to do that. It's to reduce costs or to increase revenue. There's two ways. So as far as reducing costs, workforce and labor expense is something that we're looking at very closely. The ultimate goal is to reduce and eliminate contract labor. We are well on our way. A lot of contract labor has been reduced over the last several months. With the closure of labor and delivery, that will also help because we do have some contract labor in those areas. We're also looking at all positions through attrition. Anytime somebody leaves our organization and that position is open, we are looking at it very closely. Does that position need to be replaced? Can it be married with another position? What can we do? Just through not replacing positions or eliminating positions that we felt like we could absorb internally, we've saved about $200,000 so far. As far as position consolidation, about $137,000 in savings so far. Future considerations as far as workforce and labor, once OB is no longer up and running, we are going to be changing our staffing model for our nursing. Right now, the way that our model works is we always in the back of our mind have to be thinking a laboring mom could come in. And when that happens, that takes a nurse away from all of our other patients because that's a one-on-one scenario. So once that goes away, it does open up opportunity for us to staff a little bit differently. So we will be doing that. And we're also looking at, some departments have expressed that, you know, they're working 40-hour work weeks, but they would like to go down to 36. And there is some opportunity to do that. In our particular small rural setting, departments like lab or radiology, when you look at the day-to-day staffing, it is a little bit overstaffed, but it's by design because we have to cover call 24/7. So when you're looking at covering call, you need more bodies, but for the day-to-day, you really don't need that many bodies. So if we have folks that, you know, they want to move to a 36-hour work week and their department will support that, we'll support that as well. Nobody is forced to a 36-hour work week, but we have had some folks say, you know, I would like to move to 36, and that's a win-win for us. ER staffing, that is an expensive area to staff as well, particularly with providers. We have been successful in hiring a new advanced practice provider that will be providing coverage every other weekend, which will cut down on contract labor in the emergency department as well. The other piece is looking at staffing matrices, again, just to ensure that we are staffing appropriately for our volumes. We're also doing our due diligence and evaluating any sort of major expenses such as insurance and employee benefits. We're reviewing all contracts and agreements. That's something that I have taken on over the last several months with Ray's help, of course. The course of probably 3 or 4 contracts total. For the life of those contracts that we've eliminated, we'll save about $570,000 is what we're estimating so far. And I have about another $50,000 in review right now that I think we'll be able to save. We're also just making some smart choices and getting into some new programs, such as Microsoft licensing. There is a nonprofit sector that we could be a part of that's going to save us about $21,000 annually as well. Service line evaluation, of course, that's another cost reduction piece to look at. Labor and delivery is a good example there. We don't want to cut services. I feel very strongly about all the services that we are providing to our community, and I would like to continue all of those. But at the end of the day, if it comes down to it, there are other services that we could potentially evaluate, but I feel pretty strongly that we need to do everything in our power before we get to that point. Which brings us to increasing revenue, which is a much more fun area to look at rather than reducing expense. But how can we actually bring more money in as a health system? One thing is just improving collections and billing practices. We are working on our upfront collections policy and process. So most facilities, when you go in, you will need to pay upfront co-pays, deductibles. Of course, that goes without saying. But for elective procedures, generally you'll be given some sort of an estimate and then expected to render payment upon presenting for that service. So we're working on those. Prior authorizations, benefit eligibility. Insurance is trying to find every single way that they can to not pay us, and so we are making sure that we're dotting our I's and crossing our T's to make sure that we're getting paid for the services that we're rendering to our community. Negotiating payer contracts, that's another piece. We're pretty small. We don't have a lot of negotiation power, but we're sure doing our best to make sure that we have contracts with all of our payers and we're negotiating the best reimbursement that we can. Evaluate and grow new service lines instead of eliminate. Where can we grow? There are 3 areas that are taking a lot of my attention right now that I'm trying to grow. Surgical services being one of those. With OB closing, I do feel like there are other doors and windows that will open. Surgical services is one of those. We are actively working on bringing orthopedics back to our community, as well as a couple other surgical service lines. Our swing bed program is another area of potential growth. That's an area that reimburses really well for us, and it's a good service to the community. It allows people to recover at home, be close to home, so looking to grow that program a little bit more.
Is a swing bed, that has to do with Medicare, is that correct?
Yes, it sure does. So typically, an example would be if somebody has a total hip replacement, knee replacement, they're not quite ready to go home, but they also don't want to go to the nursing home. They'll come and stay with us for rehab. Yep, exactly.
Yeah, my mother just went through that up here.
Was that
a couple
right?
months
Yeah.
ago. She's up here for 30 days.
Yeah.
It's a good program.
No, it is a good
Yeah,
program.
yep. Rehab services goes right along with that, growing our physical therapy, occupational therapy, speech therapy, and we've had great success in recruiting to that particular department. They are fully staffed. We've even had some opportunities to unexpectedly grow some staff there as well. So we are growing there. And then one of the other big things is just smart collaboration with other facilities. Similar to what we're doing with OB to make sure that we can continue to care for our community, I'm engaging in conversations of how can we share resources. Orthopedics is a good example. Our community could not support its own full-time orthopedic surgeon, nor could our finances support a full-time orthopedic surgeon. So can we lease a surgeon from another facility, pay that physician's salary for the time that they're here? Those types of collaborations. Another example would be with our electronic medical record system with Newman Regional Health. We do share an electronic system with theirs. It is separate. They can't see our information. We can't see theirs. But that saved us quite a bit of money in that conversion. We are also part of CLS, which is Central Link Service with KU Med. It's just a purchasing and supplier program. KU is much bigger than us. They have a lot more buying power than we do. So by partnering with them, we can also kind of get a break in some of those supplies and expenses as well. Jail services, as all of you know, we will be providing health services to the jail. That will not be a moneymaker for the health system, but the way that I look at it is it does help cover the salary of a provider that we already have. So while that may not make money, it's a good service for our community. We're going to provide care much cheaper for our taxpayers than what anybody else probably could. And ultimately, it does help us support a provider's salary moving forward. So continually, we're just going to be looking for ways to continue to collaborate, increase revenue, reduce costs, and at the end of the day, like I said, I do recognize that it is a big ask of the county to continue to offer support, and a little bit more support right now than what we've asked for in the past. But I'm not wanting a blank check by any means. I'm asking for a responsible investment into the health care of our community, to support jobs in our community, and we will be transparent and responsible with those funds, and showing what you, as well as what the community, is investing in moving forward.
Back on collections, you offer a payment plan to the folks.
Yes.
Do you not?
Yep, there are payment plan opportunities, yes. Yep. Are there any other questions that I can answer for you all?
I think you guys are doing a great job. I love the hospital and the services that they've provided me and my family and everything. But when we laid down, or you laid down, or whatever you want to call it, the birthing center, and seeing your request here, would that actually have been another $1 million more if we'd had to? I guess I'm puzzled that we got $1 million savings and all of a sudden we've got a major increase.
Sure.
In that. Can you explain that a little bit more?
Sure. Ray will probably help me, but the profit and loss statement in front of you, that is with labor and delivery services discontinuing in July, correct?
Right.
Moving forward. So you're still seeing a budget with half of labor and delivery services still in it. And some of those expenses, unfortunately, will carry on even a little bit past July, moving forward as we make some changes.
So, also, at the end of the day, by getting rid of labor and delivery, we will generate positive cash flow for debt service of approximately $600,000.
Okay, that's the bang I'm looking for.
Yeah.
Yes.
So, without closing labor and delivery, we would have not been able to actually pay our loans
Okay,
in '25.
understand.
So.
The loss is ongoing until that service is deleted. I mean, isn't that correct?
Yeah, we've been losing money, bottom line, for the first 3 months of the year. Yeah. So we have about $280,000 in debt service. That doesn't leave a lot of margin, and that's assuming the budget comes in where it's at. We're running slightly behind on our gross revenue, but we are doing a better job of collecting than we did in '24, so.
Yeah, you've gotten caught up on all the billing and everything, isn't that
Yeah,
correct?
we made a lot of progress.
Right.
We've actually, so far, for the first 3 months, we're collecting 5% more of gross revenue than we did in the first quarter of '24.
That helps, just be saying that and letting the people hear. I mean,
Sure.
everyone,
Yeah.
Sure.
Thank you.
Yeah, again, that's no raises, no capital expenditures. Bottom line's about $600,000. If the expenses come in, we're projected in the revenue, and collections come in as projected.
It sounds like you've got a good handle on things now.
We made a lot of progress. There's been a lot of blood, sweat, and tears, but
I'm sure there has.
we're seeing the fruits of our efforts now, so.
Any other questions?
So when you talk about having let's say a surgeon, or maybe leasing one, I believe was the term
Yes.
I used. So what kind of a cost does it cost to have a surgeon on staff?
As far as
Their
the
salary,
leased surgeon goes,
their salary,
Uh-huh.
if we had a full-time one, what's something like that cost?
so whatever facility we collaborate with, generally what they do is they will take the cost of that, the cost for them to employ that surgeon, and they'll truly divide out that salary and only charge us what it would cost them as far as salary goes. We get to do all of the billing, so we get all of the proceeds from that, and we would only be paying the salary for that specific day. As far as determining a wage, twice a year we do a wage survey with the Kansas Hospital Association. Hospitals across Kansas participate in this, where we essentially just send them all of our wages for all of the different job class codes. They compile it and then they send it back to us. The way that they send it back to us, we're able to sort and filter it by geographic or regional location. We're able to size it down by size of facility, those types of things. And that will give us a minimum and a maximum scale for those specific positions. And then a wage scale is usually developed from those numbers. Specifically at Coffee Health for our own employees, we will establish a wage scale based off of that survey. And then it's based off of years of experience as to where you fall within that scale moving forward.
So it's based off of this statewide?
It is, yes, it is.
Okay.
Yep.
Aren't you currently doing that, like in your pay management, sharing pay management?
Very similarly,
Okay.
yes, yeah, he goes lots of different
Yes,
places,
yes.
yes. The difference with him is our agreement is actually directly with him and not with another facility, so he's kind of independent. But yes, exact same mindset.
But
Yep.
to have a full-time surgeon, it would depend on number of surgeries, on numbers, correct?
It does, and that's the most difficult part with growing services in a rural setting. We're limited to our population. We're not a destination site for healthcare as much as I wish we were. We're not. We don't have a large influx coming from the outside to visit us in rural Coffee County. So volumes are very, very important, and if you don't have the volume line to support it, then you got to figure out a creative way to do it, kind of like labor and delivery for us.
So like your MRI is probably one of the things that helps you get some outside income, I would assume.
Absolutely, and the MRI has been a blessing because a lot of those larger facilities, wait times are months out for an MRI. So we are seeing outside referrals. specifically for MRI services, just because we can get them in generally within a day or two, as long as their insurance comes through for us with prior authorizations and whatnot.
Well, if you go in with orthopedics or something, the name of the person providing the services, that's worth a lot to get people in. 'Cause I know with orthopedic injuries and everything like that, parents are going to want to take a child somewhere that somebody's got a good reputation.
Absolutely.
If you could get somebody in there, share
Yes.
one like that,
Yep.
and it'll grow.
Yes, I agree. Okay. I really appreciate you all. Thank you for making time for us today, and again, thank you for your support and all that you do for our county.
Thank you,
Yeah.
and thank you.
And if you ever need anything, don't hesitate to reach out.
Thanks, Beth.
Thank you.
Okay, thank you.
Take care. How are you, Mr. Dewey?
I'm here. How about you?
I'm good.
Originally, I was going to be with your daughter this entire week.
Walking, talking. Very active.
Heidi says she's got, you got purchase. I'll try not to screw anything up. Okay. She didn't say it in her
She didn't say it.
but.
That's what she meant, though.
Okay, I guess we're ready to move on. Discuss that in period. Okay, Health Department Administrator Amelia Marshall, monthly department update and Patagonia sales agreement for the bi-directional interface for Kansas Health and Environmental Laboratories. Good morning.
Good morning.
That's kind of a mouthful.
It is a mouthful.
You understand it better than I can say it.
And I'm more than happy to answer any questions you guys have on it. I'll start with a quick update. Well, I say quick update. It's quite the list. So we recently finished our renovation of the health department. Unfortunately, we had some delamination and peeling of our health department doors. So I've been working with Vost Construction on getting those corrected. They were on site, took some pictures. Fortunately, it is still under warranty, so the manufacturer is looking to either replace the doors or if they can just reface them. I'm waiting on a response from them. The photos are under review currently. 340B recertification. And so we have 3 programs through 340B. So this just offers us discounted pricing for outpatient drugs. So the programs that we have are for our family planning services. So that's our oral contraceptives, our Plan B, and then we also, the second program is STI, STD. So that's just antibiotics to help treat STIs and STDs, and then our tuberculosis program. So that supplies our Mantox, so it's just the subcutaneous the test to see if they have a reaction or not. If they do, then we send them to get a chest x-ray. So that has been completed and approved. We have to do that recertification on an annual basis. Do you guys have any questions on that one? Okay. The next step is Kansas Board of Pharmacy recertification. So this is gives us the ability to have the medications on site to treat patients for STIs, STDs, or to distribute oral contraceptives or any medication through our clinic. So that recertification is on an annual basis. It's just to maintain our family planning program, our STI, STD program, and of course our tuberculosis program as well. Recertification opened up on May 15th, and I'm in the process of finalizing and submitting that documentation over to the Kansas Board of Pharmacy. Next item that we've been working on is the Centers for Medicare and Medicaid Services, so that's our CMS revalidation. So this occurs every 5 years, and this is just so we can get reimbursed for our Medicare renderings. So that would include like some of the immunizations that we offer to patients that have Medicare. Any questions on any of that? And that one is due July 31st, so we are on schedule to have that completed before then. Next up, reportable diseases. So as some of you may know, there is a current outbreak of measles in the southwestern part of Kansas. The current counties that are affected, Finney, Ford, Grant, Gray, Haskell, Kiowa, Morton, Pawnee County was just added last week, Reno, Stevens, and Sedgwick. So just a little bit of an update on measles. It is a highly contagious respiratory virus. It can spread easily and very quickly. It is droplet, so it spreads through talking, sneezing, coughing, and it can live in an area for up to 2 hours. Signs and symptoms, they really mimic like regular cold at first. So that's high fever, cough, runny nose, red watery eyes. And then 3 to 5 days after symptom onset, individuals will have a rash starting in the head, working the way down. Currently, Coffee County is not affected. The counties that are affected directly that has reported disease outbreaks, those are the counties that are affected, plus the counties surrounding them. So there are some added precautions that KDHE had put out for those counties. One of the precautions is just getting the MMR vaccine at an earlier age. So typically that isn't offered until the patient is 1 year of age, but now they have approved it for patients that are as young as 6 months of age, and then receiving their first dose, and then 28 days later receiving their second.
So is that a lifelong vaccine?
Yeah, so typically for the vaccine schedule for that, it's just part of the pediatric vaccines. They are offered at 12 months and then 18 months. But now, like the areas that are affected by the outbreak, they are offering it starting at 6 months and then 28 days later. But you just can't get it sooner than 28 days later.
Does that provide pretty good protection for
Yeah, and it
older
lessens
people?
the symptoms if you do end up getting measles.
I see. Just
Yeah.
curious.
Yeah, absolutely. So the individuals that are primarily at risk are the non-vaccinated or haven't previously had measles. And so best prevention is the MMR vaccine. Any other questions on that? Okay, so we'll go ahead and skip down to the immunization quality improvement plan that we initiated with the Kansas Immunization Plan. So this is just a plan that we initiated approximately a year ago to help increase our vaccine rates. Unfortunately, there's a lot of vaccine hesitancy still, so our numbers have actually decreased in various areas. I broke it down to classifications and listed the percentage decrease. I'm not going to go over all of those numbers just to save some time. But yeah, we recently started sending out letters. So we've always sent out letters for vaccine reminders. We've just expanded the age range for reminders. And next up, we have the Safe Sleep Community Baby Shower. So the purpose of the Safe Sleep Community Baby Shower is to connect parents and caregivers of infants and toddlers ages birth to 18 months. So this event was held Thursday, April 24th. We presented education on injury violence prevention areas, so motor vehicle crash, child passenger safety, traumatic brain injury prevention, maternal mental health, suicide prevention, safe sleep practices, and suffocation prevention. And then we also presented shared risk and protective factor approaches. And some of those were physical and mental health, access to high-quality goods and services, safe and stable homes and neighborhoods, community connectedness, and education achievement. The Pack and Plays to help support these safe sleep practices. The Pack and Plays were funded through the Poor SIP Community Baby Shower Mini Grant that we had applied for at the beginning of the year. We served a total of 18 mothers and expecting mothers, 6 caregivers of infants and toddlers ages 0 to 18 months. So this could be like grandparents or daycare providers. We dispersed a total of 17 Pack and Plays. And then we had 17 participating partners with local resources. So some of those are like the hospital services that they offer, parents as teachers, just various programs that we have throughout our community to connect patients with. We also have some insurance providers for Medicaid there as well for those individuals that lacked insurance or did not have good coverage and actually qualified for state insurance. You guys have any questions on that event? Okay, and then a couple of us nurses, we completed the puberty and hygiene talks at the Northern School District. We will be updating our course material for the 25-26 school year, just because some of the information is outdated. I mean, some of it's from the early 2000s, and there's some updated information that we will be educating the students on. Registered nurses, we completed the Can Be Healthy training. So this is to offer Can Be Healthy assessments. So these assessments, they can be billed through Medicaid, and they can also be used as like daycare or school physicals as well. And we just have to be careful on that, because if they see their primary care provider, we can't bill insurance for that, and we make sure that the patients know that if they have this Can Be Healthy assessment, then it takes away from the annual physical that they have with their provider. So June 30th will be the end of our current grant cycle, and the current grants that we hold is our maternal child health, and that's just over $10,000. Our immunization action plan, and that's just over $3,000. Public health emergency preparedness, that's just over $12,000. Paid to local, so this is just guarantee money that we get from the state to help support salaries. That's just over $15,000. Family planning, we received $5,000 initially, and then I requested amended funding and received an additional $10,000. So we received a total of $15,000 for that one, just over $15,000. And that one is used for our family planning supplies. Some of the items that we use for our family planning clinics and for oral contraceptives and all of that. Our new grant cycle starts July 1st. The requested amounts I have listed, we have not received final approval on those requested amounts. As you guys may know, there have been some budget cuts at the federal and state levels that might potentially affect how much we receive in our grants. So hopefully we'll have some finalization on how much we were awarded by the end of this month. Public health infrastructure grants. So this one used to be called Workforce Development Grants. It was one that was awarded back in 2023. I had applied, and I had applied for it. It was a total of just over $74,000, and it's to be used to enhance and support public health. So this is used for salaries, classes, certifications, furthering education, and pretty much just bettering the health department. So this is a multi-year grant. It goes through 2027. We have a remaining amount of $73,000. So with that being said, our budget for 2026 is coming due. There might be some changes on, like some increases on certain categories on our budget for 2026. And that is because we have this funding through the big grant that we are needing to spend within a certain amount of time. So, I mean, I think a lot of them will be under commodities for classes and training and education. Any questions on grants? Okay, so this kind of plays in hand with the grants and the federal and state funding cuts. There's been several KDHE staff positions that have been discontinued here within the last couple of weeks that actually affects the health department pretty directly because they're our point of contact. We had 2 regional immunization consultants, 2 immunization action plan point of contacts, and our Cajun's point of contact. Those positions are no longer at the state level.
So where do you have a point of contact then without those folks?
So they are reworking the regions, so they're pretty much having one person cover a wider area.
Which means less accessibility for you.
Unfortunately. But they're typically pretty good about having instructions or policies and procedures in place for us to follow.
So it's something you can probably work around, but
Oh,
it's gonna
absolutely.
take away the timeline, maybe takes you longer to accomplish
Yep,
certain
that is
things.
absolutely. Yep, I mean, it's unfortunate, but I understand where they're coming from.
Sure.
It was pretty, there was no foresight on this. It was, the decision was made in one day, they had a meeting, well, they made a decision like 8 in the morning and had a meeting at 3 and notified of the discontinuation of the positions.
Well, and that may get resorted as the needs, when there's a need that can't be met, maybe that'll be dealt with, after the dust settles, you might say.
Yeah, and one of the main positions for our regional immunization consultant, she was the one that actually did our compliance visits. So I'm curious to see how they plan on doing that because we have compliance visits once a year. And we have one coming up, so we'll see. Yeah. So next up, we have the Kansas Health and Environment Laboratories. So the purpose of this is to conduct testing for public water supplies, newborn screening, blood levels, bacterial diseases and parasites, and reportable disease testing. So that's virology and serology. So it's like testing for STIs and STDs. So anything from syphilis, HIV, hepatitis A, B, so on and so forth. We utilize this significantly in the health department because that's one of our main jobs for the health department is disease investigation, tracking, testing. So we use Cahill quite often. So effective October 1st, Cahill will no longer send lab reports via fax, and that's currently how we get those lab results for our patients. They will only be available via email, web portal, print and mail, or direct interface. Print and mail I'm not the biggest fan of just because you pose that risk of breaching patient privacy. So Coffee County Health Department, we currently receive the results via fax. They do have a bidirectional interface with Patagonia. Patagonia is an EHR that we currently use. So what that means is we can put orders in for STI or whatever orders we're testing. So I'll just do hepatitis C for an example. We can put the orders for hepatitis C into our system, and it'll send it directly to Cahill. So that order will be ready and waiting for that blood specimen whenever it arrives to Cahill for it to be tested, and I'll have all the patient's information, the demographics, date, time of collection, what specimen it was, how it was collected, and what order. And then once those tests result out, it'll result out directly to that patient chart.
So are the patients able to go into the portal and look at you said something about a portal. Is that available into the patients?
So eventually, yes.
But not right
We are currently, so Patagonia is still pretty new to us, so we are still working on getting the patient portal up and running. So once the patient portal is up and running, they can log into their chart and see those
Right.
results. And that includes lab results that we send, or labs that we send off to LabCorp. That's our company that we use. They will be able to log in and see what those results are as well.
I was just curious.
Yeah. So with this, it has the initial fee of $4,000 to initiate the contract and the service. And then once implemented, so this is once we go live. So after all of the testing, making sure that all the results are running through correctly, it will be $110 a month for a subscription fee.
So that $4,000 is a one-time initiation fee?
That's correct.
There's no annual
There's
fees?
no, there's
other
just
than
a
110 a month?
monthly, yep, just a monthly 110 a month.
Recurring?
Yes, and it does have, there is always the risk for it to increase, and the reason for that is that there's like a high influx of labs needing to be ran. So an example would be like the most recent pandemic. So those COVID tests, they were ran through the state, and they actually increased that monthly fee. But we do in our sales agreement, if we wish to proceed, we do have a 2% cap increase annually on that.
Okay. So, motion.
Yes, there's one item I would like to request. So the signature of the person that, for the sales agreement is typically the point of contact, and that's how they have it wrote out in the sales agreement. If you guys would like me to change it, I can reach out to our rep and have, okay.
That'd be you then.
Mhm.
No, that's fine, I think, yeah. I don't see that that's a problem, is it, Mr. Bowie?
As long as you authorize it.
Yeah.
Do you want to have her specific name on it or head of that department? As a contact person?
I think she should be the contact on that, and if she has anything that's financially, should bring it back to us.
Yeah.
If there's any increases
Yeah.
or anything like that, absolutely.
I mean, I guess we could change, you know,
I was just
Yeah,
thinking about
position
longevity of it. If something was to happen and she wasn't around.
well, I guess she could sign it, could be
Transfer.
as a department head. That'd be satisfactory. Yeah. Okay.
But her name, Amelia would still be the name was point of contact, correct?
Right. That would be name and position on there. Motion to authorize and direct the Public Health Administrator, Amelia Marchant, to sign the sales agreement with Patagonia Health for the bidirectional Kansas Health and Environmental Laboratories, KHEL, lab interface with an initial fee of $4,000 and monthly subscription fees of $110 upon implementation of the interface. Been moved by Barker and seconded by Peterson. Any further discussion? All in favor say aye.
Aye.
Motion carries.
I had one question here.
Yeah, absolutely.
On the public health infrastructure grant,
Mhm.
and it's a multi-year grant.
Mhm.
Spent like $1,400 of it. What's going on there?
Yeah, so it's just the way that it landed on the notice of award. So the notice of
Okay.
award occurred towards the end of 2023, beginning of 2024, so budgets
Okay.
were already due. So
Sure.
we're kind of behind on it, but
Are you gonna be able to transfer that money if you don't use what it was granted for, or you'll spend it down?
we'll spend it.
Okay.
Yeah, yep, yep, but we'll find a way to spend it. Because, I mean, it's either spend it or just lose it completely, and
Don't want
It's
Yeah.
something you can't carry. It's
Mhm.
something you can't carry, is that correct?
no,
You've got-
nothing that we can carry over past 2027. Mhm.
to get it all.
Yep, yep. Well, I was very detailed on that grant writing, so we have everything listed out that we will be planning on spending. Yeah. Any other questions?
As All the information.
There you go, happy Tuesday morning.
Yeah.
Well, thank you for all you guys do for us.
Doing a good job.
Thank you.
Thank you.
Thanks.
Okay, well, I guess we want to go ahead and take a break.
Yes.
Yes, we'll come back at 10:10. Yeah. Okay. Economic development, emergency management, monthly update. Good morning, Amber.
economic development,
Well, we could,
I can wing it, but
Give it a shot.
I skipped one too far down the list here. I'm
I
sorry.
can wing it.
Good morning.
Good morning. This is a short one. Tower project, the radio towers. Martin said that he is waiting on a report from the archaeologist for the sites that said there's nothing there preventing us to dig. Apparently, to get these permits and everything, you have to have an archaeologist come out. So he's waiting on his report that says there's nothing there.
For each one of the sites?
Yes.
Okay.
He's waiting to talk to the fiber board for the next time they meet, to see if we can get on the county fiber ring. So the cost of the circuits between the towers and here where all of our radio hub is, could be very cheap, a lot cheaper. Could save us possibly $1,000 a month if we can get on the county fiber between here and there. I don't know all about the fibery things, but he's working with them, just waiting for them to meet again, I guess. Other than that, he said he's just kind of in a holding pattern for now. We've done all we can. Now it's all the busy people and permits and all that stuff. And then they can start shipping parts and pieces and start doing some stuff. So, don't know much else other than that on towers. Did want to clear something up. There was some confusion about cameras and traffic counters on county roads. We've received several inquiries. Apparently someone is telling people there are cameras for the solar project or something else nefarious. I'm not sure what they think it's for, but there are traffic counters on 22nd and Fauna and 17th and Kafer. And those are KDOT traffic counters.
One in Lebo, too, a counter.
Is there a, okay. When I talked to Ryan, he didn't say anything about that one, but, Fauna and Kafer, those are road studies by KDOT to check the amount of traffic on the road, so not anything scary, I guess.
So you've heard that they're for a potential solar project?
That's a new one. I thought I'd heard it all.
Yeah.
Not surprised anymore.
Right. I believe that the sheriff has some license plate reader cameras in a few locations around. I don't know a whole lot about those.
He discussed this
Did he? Okay,
with
good,
us, yeah.
good.
And they sound very useful.
Yes.
Yeah.
Those should be on roads going in and out of the county, like at the
Yeah.
county borders, because, you know, when people are running through here, they're going out.
Yeah, the purpose is not to reiterate, the purpose is not to track people. It's, say, for instance, just like this huge road bus they had, they can use over in Lyon County.
Yep.
They can use those tag readers to help them track a vehicle if they lose track of it or something.
Absolutely. So those are out there.
Kidnapping.
Those aren't scary unless you're doing something bad. So, you know.
Yeah.
But the traffic counters are just that. They are counting the amount of traffic and what kind of traffic those roads have. So I want to clear that up because we did get a couple calls. Working on budgets. Those are due coming up next month. The big thing is our FEMA evaluated Wolf Creek exercise is next Tuesday, June 3rd. I have made provisions in my next revision of the plan to activate my EOC sooner than an alert. Because apparently in our plan it says that I would activate for a Wolf Creek event at alert. Well, for a HAB situation, that may not get to an alert level. That could be gunfire, explosions, things happening, but there's no relief, so it doesn't really take us to the alert level. I don't know if you guys remember this last time. We waited till an alert, and then it went straight to a side area, like poof. So we were sitting there waiting on people to get into the EOC to start doing what we needed to do. And if we're taking a week's worth of stuff and cramming it into one day, every second kind of counts. So we were ready to start evacuations, and I didn't even have the fire guy in there to activate a host county. So this time, at the first hint of something going on at the plant, I'm going to go ahead and activate my EOC. So you guys know that on that day, just be here around 8. Be waiting for your text or your call or whatever. I will text everybody on Everbridge and let them know that the EOC be activated, and I also do it over the county phones. You have cell phones, right? Yeah. Yep. I'll make an announcement over the county phones for everybody to start coming down. If you have a county ID badge, you have a fire badge, right? I wonder if you need another one.
You can use mine and just add to it, can't you?
It'll still say fireman, and if you're trying to get in somewhere as a elected official, it may not work for you.
Your call, you're the expert.
I wish Steve was here. I don't know if we got it, if Steve has 2 or not. I don't know. Let me talk to Julie and I'll get back with you on that.
Yeah.
I'll let you know.
Okay.
Have your county ID with you, because that's how you're going to scan in. If not, you get the big visitor badge of shame.
I noticed one person that had that the last one.
Yeah, they've been listening to me.
The sheriff.
Really?
Yeah.
Well,
I never noticed that. I saw
I
that.
got like 3 badges. I forgot all of them. So be ready just a little bit sooner than normal, because at the first sign of explosions and gunfire at the plant, I'm going to go ahead and activate. I would be calling people in if something like that was happening at our nuclear plant. I mean, really. Just because my plan says I wouldn't activate soon does not mean that I wouldn't. I activate that thing for floods and tornadoes and, you know, all kinds of stuff, so that would be one that I would do. We are all pretty busy preparing for the exercise. We've been updating the special needs lists. We've been doing plan updates, call lists, checklists, making sure everybody has everything that they're going to need, doing some extra training for some people. I will send out an email reminder to all players this week, and then I'll send out the exercise plan a couple of days before, whenever KDM sends it, and that's that plan that tells us what they're kind of evaluating us on and what the initial conditions are. So be looking for that in your email. It's a big, long document. If you don't want to print it, you don't have to. I'll have copies in my EOC that I'll waste my ink printing. So that's about all I've got. Does anybody have anything? Any questions on the upcoming evaluation? It is FEMA evaluated, so there will be FEMA people there, and they will be judging us.
We're gonna have a public meeting afterward.
Afterwards?
Day-
Oh, yeah, they are.
day or
So,
two at the library.
so like a week,
No
yeah,
one-
like a week afterwards, they do have, and I'll send out a notice about this, but thank you for reminding me. They will have a, do you know the date on it?
I was wanting to say it's Wednesday,
I've got it.
but
It's on the calendar.
it's gonna be like right day after, I believe.
Yeah. There is a, maybe not. Maybe I don't have it on there. I swore I put it on there. Exit meet. It's a FEMA exit meet. Oh, June 5th, Thursday.
Yep.
Thursday, June 5th. Participants can come at 10 a.m. This is pretty much a meeting for FEMA to give their initial evaluation. It's not the final because they got to go back and do things, but 10 a.m. at the Burlington Library. FEMA will give us an exit meeting, which pretty much just kind of goes over what they saw, couple of suggestions or something like that. They won't have any problem with us, I'm sure, but that's prior to them turning in their final evaluation, and then that's what we get.
That's at 10, and then at
Yep.
11.
At 11 is the
that's
public,
for
yeah.
public.
So it's open to the public, if the public wants to come in and find out more about this process, or they have concerns about Wolf Creek or FEMA's role and all that, they can come in and talk.
What date is that?
That is Thursday,
June
the 5th, June 5th, yes.
At the library.
Yep,
Thank you.
in Burlington. So if you guys want to come to that, you can. Don't have to. I'll report out anything that happens there if anything comes up, which it won't for us, but, and that's all I have, pretty much. I'll let you guys do it. Thank you very much.
Thank you.
Thank you. Thanks, Alex.
Yep.
Well, I guess Jenny's not here, so you wanna sign some stuff, or go ahead and go with road and bridge, or what do you wanna do?
Let's get Ryan done and
Keep moving.
Okay.
Get out there on the road.
Yeah, Ryan, road and bridge superintendent department update.
You can stack it there.
All right. Good morning.
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 Oh, let's see. I've got a few motions. Got some summer help, CP2s. I think there's 4 of them here. And this would be the rest of our summer help that's coming on.
Okay. Motion to authorize and direct the chairman to sign the CP2 for Brighton Lind Highway Seasonal Light Equipment Operator, wage classification 25-03, wage $19.51, effective 5/27/2025, number of hours worked not to exceed 1,000.
So moved. I'll second.
Been moved by Abendroth and seconded by Peterson. Any further discussion? All in favor say aye. Aye. Motion carries. Motion to authorize and direct the chairman to sign the CP2 for Chance Haig, Highway Labor Crew Member, wage classification 5-01, wage $15.54, effective 5/27/2025, number of hours worked not to exceed 1,000. I'll move.
Second.
Been moved by Thompson, seconded by Barker. Any further discussion? All in favor say aye. Aye. Motion passes. Motion to authorize and direct the chairman to sign the CP2 for William Griffith, Highway Labor Crew Member, wage classification 05-01, wage $15.54, effective 6/2/2025, number of hours worked not to exceed 1,000.
So moved. Second.
Been moved by Abendroth and seconded by Peterson. Any further discussion? All in favor say aye. Aye. Motion passes. Motion to authorize and direct the chairman to sign the CP2 for Caden Hawkins, solid waste, labor crew member, wage classification 05-01, wage $15.54, effective 6/2/2025, number of hours worked not to exceed 1,000. I'll move.
Second.
Been moved by Thompson, seconded by Barker. Any further discussion? All in favor say aye. Aye. Motion carries.
All right, thank you.
Brian, how many of those, does that fill your list up for summer help there?
Yeah. So, we've actually got 11 right now, but we have one that's gonna be leaving next week, I think.
Okay.
And then, I have a couple out of the landfill, and they had busy summer schedules, so they're kinda half-time. So I got them set up that I think there's 1 week that they'll be there the same. We got something out there for them both to work on, but other than that, through the summer, it'll just be one at a time out there. But yeah, this fills us up.
Your summer help's pretty much full in now?
Yeah. Yep. Next, be a motion. This is just to sign the contracts with Kilo. And this would be the asphalt project out on Fauna Road going up towards Jacobs Creek. I've got it right there. All right.
Sorry.
Don't ask me to help. Sorry.
There somewhere.
Okay,
Okay, sorry about that.
sorry.
Motion to authorize and direct the chairman to sign contract documents with Kilo Construction Hot Mix Project number A2502-C. I'll move.
Second.
Been moved by Thompson and seconded by Abendroth. Any further discussion? All in favor say aye. Aye.
They give you
Motion
a
passes.
start date on that?
I think they're thinking here in a couple of weeks, first part of June. I know it was gonna be July, but so maybe it's gonna fit their timing to move it up.
Yeah, I know you said
sooner.
they thought they could get to it sooner, so.
So I know they're working around New Strong, Burlington stuff now, I think, with some projects, so.
You said that was Fauna Road?
Fauna,
12th to Jacobs?
yep, up to Jacobs Creek.
Okay.
Yep, all right, thank you. Extension office,
Did you guys vote on that one?
Yeah.
the extension office, called and asked, had a request for a load of dirt up there. They've got some settling and stuff around their building, and, so I just said I'd talk with you guys. I think they have somebody lined out to maybe level it off and do some seeding and stuff up there, but, they're just needing a load of dirt. We've got some out the landfill, and so if it's all right with you guys, we'll take a load of dirt up there.
That's
Just
fine.
the building on Cross Street?
Yes. Yeah, some stuff back behind there, I think.
Yeah, they mentioned it'll be here sometime back.
Sounds good.
Okay. We've got a need for a new tire machine down at the shop. The machine we have is, I don't know how old it is, 30 plus years old. Been there forever. It's worn out. I mean, we've been fighting it for the last couple of years, and it's finally bit the dust on us. Got some prices, and so we're looking at $11,700 for a new machine. This is for a company out of Lenexa. They're able to come down, service it, or look at it if we have issues. We do all of our own tires with it. We also do a bunch of stuff. All the tires we get in and out the landfill, we got to break those down, tires and rims. So that's, I know here a couple of weeks ago we had some summer help. We had probably a dump truck load of tires we were breaking down, and the machine finally gave out. Like I said, it's had issues for a couple of years. It's over the $10,000 price mark, so we've gotten prices. We don't have to go out to bid for that, but I just need your approval.
So what type of machine is this just for how big a tire?
Well, this one is actually, we'll take up to a 19.5 tire. The one we had before wouldn't go quite that large, but, we run a lot more of those tires now. So this would just be a step bigger. Keep us from having to handbrake a lot of the tires that we were having to do before. But this will take up to a 19.5 tire. As far as the brand, we talked around with all the tire shops, bars and whatnot, just as we were looking to upgrade. And this is kind of who have started going to, the people around, just due to the serviceability and having somebody that can come and work on it if you need it.
So what type of machine, what brand of machine?
This is a Hunter TCX. 53.
Okay. So your truck tires, you're using like a golden tool or something on them?
Yes.
How do you change that?
Yeah.
Okay. Don't have I guess it'd probably kind of be two different things. You don't feel you have a need for a machine for those?
I don't think so. I mean, I think Craig said he's happy with how they're doing those now, and I think with the dollars that machine costs.
Pretty expensive.
Yeah, I mean, this is what, he recommended to fit our needs.
Okay.
Well, is there a problem with people bringing in tires on rims, just having to break them down, some of them?
No, that's priced separately out there, so if something comes in on a rim, there's, I don't know what the price is exactly,
Okay,
but it's a
but
little
you're
bit more than just
being
a.
compensated.
There is a charge.
Yeah, there's a charge,
Okay.
but, we cut them tires up, but yeah, they gotta be dismounted from the rim, so, we get days like this, wet weather, we'll have our summer help. Yeah, keep them busy on some of that stuff, so.
Okay.
So, all right.
I don't have an issue with that, you guys. Okay.
All right, I appreciate it. That's all I had. If you guys have anything for me? I'm short and sweet for the most part, so
Okay.
that's what we like.
Okay.
So, all right, appreciate it.
Okay,
Thank
thank
you.
you. All right, Economic Director Jenny Tapman, request for proposal for engineer for Ray's Countywide Trails Planning Grant.
Yes.
Good morning. I want to
Good
point
morning,
out
guys.
you were here ahead of your scheduled time,
Oh,
but,
okay.
but we were running ahead, so we went ahead and pulled Ryan ahead of you, so I just wanted to
That's
point
fine.
that out.
I always try to hop in a little early because I know different things.
Yeah,
take
that's
next
fine.
time.
You were here way ahead of your appointment. I just wanted to point that out.
Perfect. Better to be early than late, right?
Thank
Oh,
you.
I did have one other thing. Rhonda wanted me to bring this up to you, Wade. This is from Civics Plus for the website. I guess it's the invoice, and there's a spot for you to sign that. So, not related to the Trails Grant, but
Okay,
I think she said you had already approved it.
I believe that's right, isn't it?
Sounds familiar.
That'd be for the county website, for Civics Plus to do another year.
I've been going back and forth with Rhonda with them on specific language that I wanted in the agreement on behalf of the county.
Thank you.
So it took them a little while to,
To get this.
they kept on sending revisions back that didn't include that language, and finally they got it right.
Perfect. I just saw the invoice and passed it on. The other thing I was going to talk about is, you guys know we had applied for the Ray's Countywide Trails Planning Grant. I've been going back and forth with Garrett Nordstrom. I know if you want the copies. RFP. So he, I think, had worked on it, the grant application some, and then CFS engineers, they had worked on it before I got here. So there's the application. We were awarded the funds, but now we're still kind of waiting for the grant agreement to be executed, and that's because there's been some turnaround. It's a federal grant, and but talking to Garrett, he's still fairly confident that we will be that the agreement will be executed. We've been going back and forth with the Federal Highway Administration because they're over the grant. I haven't personally heard much from them, but I did go ahead and have Garrett write up a request for a proposal for an engineer, because if we do get the funds, if the grant is executed, we get the funds, the big part of it will be to have an engineer do the design and plan work. That was what the $2.6 million essentially was for planning. So I figured we could have this, and then if we don't get the funds, we're still, I think, wanting to move forward with the countywide trail plan from the 2022 trail plan that was created by CFS. So I felt like it didn't hurt to go ahead and have the proposal. What I'm wanting from you guys is, Garrett suggested we go ahead and post the proposal for request for engineers for the project? Or do we wait until the actual grant agreement has been executed and we know we have the funds in hand? But I wanted to get your guys' thoughts on that.
To recall, the grant, is that a cost share? I can't remember.
This is before we were there, Mark might have, was in the newspaper, but I just remember seeing it in the paper.
Right, this one was not, I don't think it was a cost share, it was the it was, $2,645,000 was the grant. So the county was not expected to do a cost share like the CDBG grants or things like that. That was the amount that was awarded to us for planning and design for the countywide trails plan based on this document.
Okay, so this is just for the planning portion.
So it would be the next step from this before we would actually be able to implement any kind of what they came up with. Because in the 2022 document, they were suggesting a figure for implementation could be more like $30 million. I mean, it's a big project.
Yeah, I have real concerns with the portion of it. I think the trails within the cities
Here, you can have this. I just printed out your copy.
could provide a lot of good, but I'm really concerned about this trail from New Strong to Burlington, and my concern is you're gonna have a large area down here. I mean, I think it comes up through, on Links there, have a large area that's gonna be pretty secluded. I'm just a little in question who's gonna utilize that and the safety of those people on that trail.
The biggest,
Just myself, I mean, I'm not saying that I would oppose it if that's part of the plan, but I have real concerns about
The safety of the issuance, how you're going to.
crossing the river,
Right. And that was a big part of the 2022 trail plan, was that connecting Burlington to New Strong. I think there was a bridge that would need to be built, and then that part of it. And then there was also the individual trails in each community. Now, I have heard already, as I've been out in some of the city council meetings and talking to different people, that from some of the individual communities, there's still a real interest in developing trails like Leroy. I heard, maybe they're interested in connecting to the bigger trail system down south. Gridley is very interested in a trail from their city of Gridley out to their city lake, which is only about 5 miles, and it's not a huge trail there. I just know Lebo's been interested in a trail like around their city lake for quite a while. So I think there's these smaller projects that are part of this, whether or not with Burlington, that big project remains a central focus. I think that would be a question, definitely.
Right, and like I say, if that's the only way to get the other, then I guess,
Right.
Initially, I think there was even possible trail from like Gridley to Leroy, real
Right.
extensive deal.
Interconnected, and that's what, if we get this large grant funding, that'll help kind of lay out the specific cost and design for all of these different pieces. That's why it's such a large grant.
And you said if we get it.
Well, yeah, it has not been executed yet. So we were awarded the grant, it was announced. We have not signed the paperwork to execute the grant agreement, which is what I'm trying to work on right now. So I can't tell you for certain until the ink is dry on that one.
Sure.
But I have also been looking at, like I said, portioning out some of those projects with individual communities. I was going to let you know something I've been talking with the Gridley mayor on is a possible Patterson grant for kind of their project. So it would be countywide trails, but it would be a year project to focus on the Gridley Trail from Gridley out to the lake and around their lake. And that's what I was also going to bring up to you guys, is that okay that I'm working on those individual projects as well, if there's grant funding?
Yeah. I want to see its benefit in anything we can, I just have my concerns about part of it.
Yeah, and if we didn't get we didn't get the funding for the federal grant, that would be my suggestion, is to possibly look at individual projects with each community and kind of
Because there could be some real benefit there for every community, I think, has some
Right.
things they wanna add to.
Right, and if we started and say like, okay, well, for 2026, maybe we have a focus on one trail that's kind of ready to go and do some planning there, that doesn't mean we can't also do planning for other communities while we're kind of doing all of that. And if you get some costs for one thing, I mean, you could transfer it pretty easily to other projects.
Is there any, thought about upkeep on it? Will there be another grant that will come along in, say, 20 years when they're going down, or is that gonna be a county responsibility?
Right. I think it would be, you know, possible different funding sources for upkeep. There are sometimes, like you said, grants for some of that. I know I talked last week with somebody from Sunflower Foundation. They said next year in 2026, they may be releasing some more trail funding grants, because they do like to fund different trail projects throughout the state. Just not this year, they didn't release one, but hopefully that'll be upcoming. You know, I could also see that maintenance be part of like individual cities' budgets, or possibly some county funding if it's there. So if I'm working on grants like this, do you guys just want me to kind of send you what would be the application before we submit it? Is that for approval? I mean, this one would be about $150,000. It's not a huge grant.
You're talking about the,
For the
like the city grants?
yeah, like a Patterson Foundation grant or something like that. That would be more grassroots planning kind of stuff.
Just make us aware of it, I guess.
Okay, that's just like how.
I think it'd be nice, you know, hey, I'm thinking about this grant.
Okay.
I'm thinking about this, and
Yeah.
we'll just give you the lead to run with it. Or if
Okay.
there's something that's maybe a conflict somewhere that we foresee that you haven't,
Okay.
we could discuss
Yeah.
it at that point.
Might have some knowledge that's come to our attention.
Okay.
Yeah.
Like for this one, it's due in July, and so I already started kind of working on some pieces. I'm gonna meet with City of Gridley to make sure that they're on board with it.
Sure.
For this one specifically, but as other ones come up, I think there are, you can still see there's avenues out there for trails as economic development or trails as community building. It's seen as also kind of a multi-generational, something that's good for the community too, so. So I guess going back to the RFP, do you want me to wait on that till we hear more about the federal grant before we would post a request for proposal for an engineer?
I think we need to wait and see if you'll get the money before you go dump a lot of time into it.
Okay.
So,
I am okay with that. I just thought I would run it by you guys first.
I mean, hopefully it comes through and we can all benefit from it, but.
Yeah, I'm hoping we'll hear soon, but I just can't say for sure until we do, so.
Right. We'll have to tie up a retainer or something.
Right.
And get the grant.
Yeah.
Have her put hours and hours of work
Yeah.
into it to come.
Right, okay, but we do have it, we at least have the document so that we're ready when we hear back. So I think that's good.
That's good.
All right, is there anything else you guys have for me today? All right, thank you so much.
Thanks very
Yep.
much.
Thanks, Cindy.
Appreciate all your efforts trying to get things going.
I'm trying. I don't like to just sit around and do work, so I stay busy.
understand.
Keyboard's pretty dead.
Right.
Can I have this?
Yeah, you can keep
Okay,
that.
thank you.
I've got copies in my office. Yeah, that's true.
Sign a few things before Heidi gets here.
Yeah.
On that front porch trail. Do the inevitable.
May the fun begin.
Your basket?
Go, sir.
Thank you.
I could cover the pay app, this one is not long and drawn out.
It is just one. It is just one pay.
Okay, oh, if you wanna do that, that's fine.
I mean, I know that's surprising and the look on your face.
Say what?
Speechless.
Said it all.
Dill.
but there's a reason why. So here's your motion. You'll see on your screen there's a motion, but this has a little extra language to it. And there's a reason why.
So reading over this sheet, or on, you know, on your item here on the agenda, it says pay application number 18, retainage in parentheses, law enforcement center. So they'd like to have some of their retainage money, I'm guessing.
That is exactly right.
And your note here on the bottom says it was reduced from 10, that would make it reduced from 10 to 5% retainage at 50% project completion, which I'm sure they're well beyond 50% project completion.
That is exactly right. So
they're screaming a little.
So in the very middle of what I handed out is actually a screenshot from the contract, and that talks about in 11.1.8.2 reduction or limitation of retainage, and that's the contract language, reduction to 5% retainage at 50% completion of the project. So that's where this is coming from, and technically we're behind the power curve.
Right.
They haven't asked for it until now, but
Good.
what they're asking for is within reason, considering.
Yeah, we're far past half.
Yeah.
I'm sure hope.
Well, I sure hope so too. So it's this middle section right here that's on your sheet. This is for what everybody, so people can see. And this is the document itself. So you'll see tab number 18 up in the upper right-hand corner, the pay period to May 2nd, 2025. It's the same thing you've seen many times before. Current payment due, 1.127,307 cents. And we don't cover these sheets. We fly right into the individual tabs for all of the contractors, which is what all of these things would be. For example, right here where I'm looking, Division 3, Concrete Unlimited, they would have their separate pay app. We'd go through the pay app. I'd say with retainage, this is the amount. Well, now we're just going straight to the retainage. All the retainage here on the right-hand side has been covered in previous pay applications with each of these subcontractors. They're being overseen by River City Construction, so Concrete Unlimited, Wheatland Masonry, HME, The Steel, IVC, Alpha Roofing, DH Restoration, Roxburgh, Soworks, Always Faithful, Commercial Flooring. All of this, I'm not going to go through each and every one of them, but at the very end, this includes allowances, it includes change orders. As you see, it has all the change orders. And here's where our total number is at the very bottom. So these are items you approved through previous pay apps, and now they're requesting the retainage. I don't know how else to explain it better than that, but
Yeah.
So unless there's any questions, and this I think makes sense. I think you're ready for the motion.
Okay.
Back on your previous page there, Wade, on H, had the percentages of them in there, which, oh, that, there you go.
Yep.
So you got 100% and change order 33.
Yep.
You got different percentages in there. Is that the amount of completion that's left to pay on that specific line item?
Let's go straight to the top here.
Yeah,
So-
just pick concrete unlimited up there,
Yep.
Division 3. You got 87.59%.
That's how much they've
Yeah.
got left.
Okay.
So their original,
1.
that was their original
62.
bid for the entire project.
Gotcha.
This is how much they've
The
been,
3C.
yep,
Okay.
up to date, so they're 87.59 as of this payout.
And that balance there is the difference between
Yep.
contract and what they've been paid, so.
That's what they have left.
All right, that was my question on the percentages there.
Yep.
Can you go down to the bottom?
Very-
Where we were talking about change orders.
Yep.
Maybe silly, but there's $25 million worth of pay order changes.
Right here.
Yes.
This is the total for,
Total for everything.
Yeah.
Okay, all right.
yep. It's just added in
It all
that,
up, okay.
that total column. So we're close.
Okay.
I mean, if you look, we're basically at it.
88%.
Yep.
So you got, what, 3.166 million there left?
Yep.
Okay, are you ready for the motion, guys, or? Okay, a motion to approve the application and certificate for payment, application number 18 for period ending 5/2/2025, submitted by River City Construction LLC in amount of $1,127,300.07 for work completed, reference the Coffee County Law Enforcement Center project, which is retainage, funds to come from the jail construction project fund.
So moved.
I'll second it.
Been moved by Amondroth and seconded by Barker. Any further discussion? All those in favor say aye.
Aye.
Motion carries.
See, that was pretty harmless, wasn't it?
And I'm spending $1 million.
Is that all you have?
So,
Maybe round table, huh?
I've got some pictures that will tie into something else.
Okay.
Mike knows.
That's my
Okay. Well, guess we'll move on to Heidi then. Planning and Zoning Administrator Heidi Harris, Comprehensive Plan Promotional Video. Morning, Heidi.
Morning, Commissioners. Okay, so Marvin Planning Consultants messaged me last week, and I wanted you guys to have the opportunity to review it before I said it was okay, and then also have it on the YouTube so people can see it as well. So this would be the new one.
Okay. Because their sound goes with this too,
Yes.
right?
There's
popcorn?
Huh?
Did you bring popcorn?
Fresh out. You know, you could go spend about $52 and get it out of the machine.
Yes or no, Heidi, that was some question.
You ready?
Coffee County is a place where progress meets tradition, where wide open skies stretch over thriving communities, hardworking families, and one of the most vital engines of our state's energy future. From the towering turbines harnessing wind on the prairie, to the reliable output of Wolf Creek Generating Station, Coffee County plays a central role in powering Kansas and beyond. Our commitment to energy production fuels local jobs, supports our economy, and keeps the lights on across the region. But progress doesn't happen by chance. It takes foresight, cooperation, and thoughtful planning. That's where you come in. Coffee County is preparing for the future, and your voice matters. Whether you're a farmer, a teacher, a business owner, or a student, your ideas will help shape decisions about land use, infrastructure, housing, economic growth, and sustainability. Planning events and surveys are launching soon, and we need your input to make sure Coffee County continues to grow in a way that honors our values, protects our resources, and prepares us for tomorrow's opportunities. This is your county, your future. Be a part of the plan. Join us and help power what comes next.
So that was the video. So did all the city, I think I saw all the cities present in this one. So they wanted to know, I called them a little bit ago, because they're supposed to have an 11 o'clock tonight, but I was on the agenda for 11. So they wanted to know if there's any other changes you wanted to see done with the video, or if you like it. So this could be our promotional video for the comp plan.
Good.
And then if you have any other questions, I'll stay on back them today too, so I can ask them.
So how exactly are they gonna use the video?
From what I gathered, that they put on the county, the comprehensive plan website that's getting ready to be launched. Plus, we'd also put it on our website to promote people to come and understand what we're doing and what we need them to do for the comprehensive plan. So that's what I understand with the videos for, and how they use it.
I like it, looks pretty good. I'd like to see more of agriculture in it, farm around.
We'll see some more agricultural farm ground in
You
it.
had some elevators in there, but we have quite a strong farming community around everywhere.
You want me to play it one more time? I mean, it plays quick.
Sure, that'd be fine.
Nestled in the heart of Kansas, Coffee County is a place where progress meets tradition. Where wide open skies stretch over thriving communities, hardworking families, and one of the most vital engines of our state's energy future. From the towering turbines harnessing wind on the prairie, to the reliable output of Wolf Creek Generating Station, Coffee County plays a central role in powering Kansas and beyond. Our commitment to energy production fuels local jobs, supports our economy, and keeps the lights on across the region. But progress doesn't happen by chance. It takes foresight, cooperation, and thoughtful planning. That's where you come in. Coffee County is preparing for the future, and your voice matters. Whether you're a farmer, a teacher, a business owner, or a student, your ideas will help shape decisions about land use, infrastructure, housing, economic growth, and sustainability. Planning events and surveys are launching soon, and we need your input to make sure Coffee County continues to grow in a way that honors our values, protects our resources, and prepares us for tomorrow's opportunities. This is your county, your future. Be a part of the plan. Join us and help power what comes next.
Where was Goodley at?
I think they accidentally did the Leroy
Yeah.
Water Tower.
Had a picture of the church and then what they're doing.
Yeah.
Okay.
I think, yeah, we need to have that probably corrected too, obviously.
Just making sure.
So, yeah, so the Gridley, yeah, I saw the Leroy, water tower twice, so I'm wondering if one of those was supposed to be Gridley instead of Leroy. We can do that, and then you wanna see some more farm ground?
Just with maybe some of the some of the traditions and heritage and everything, and that's a big part of the county.
Okay.
Maybe some cabins. I don't know, I'm just saying that, and just touching
So you
everybody.
wanna see a little more agriculture in the video?
some ag around the
Yeah.
little towns, the smaller towns. But, yeah, there's no really close up to livestock. Nobody was in a tractor.
Yeah.
That's probably part. Somebody was burning a field, I saw that.
Yes, that's back in the turbine piece video.
They're not.
That's good.
So once they make those changes, do you wanna see it again, or are you okay if we just send it live after that?
If they get those in there, I'd be fine with it, just send it out, so
Yeah.
bring it back, keep going.
So we'll get the water tower switched out, 'cause I saw that.
Yeah, I didn't know.
I think Leroy was done twice, and I think one of them should have been Gridley.
Yeah, and I don't know if they had many other pictures of Gridley other than,
The church.
yeah, just the church.
Okay.
See,
We could see about adding some more,
I think their lake's fairly popular. I mean, the little Grizzly Lake, it seems like there's always a lot of people
Yes.
on the weekend.
Are you limited on the amount of time it can go? I see that video is a minute and 30 seconds.
They didn't tell me. I can ask them when we talk today and
Maybe
tell them
throw
what
in
we'd like to see more of
10,
in the video.
15 seconds of video or something
Yeah.
on it.
Okay,
I'd like to see some more Gridley if we can, and like what Todd said.
so Gridley and Farm Ground in the video, and then switch out the water towers,
Yeah, some livestock maybe.
livestock specifically. Okay. Okay, well, I'll do that, so. Other than that, I'm just calling everybody about the focus groups right now, getting them lined out, so. And getting the policy on camera interviews, which would be like this, except for there'll be a person, and the background that I'm looking at would be what you saw, the Wolf Creek nuclear, we'd be over there at the lakeside, and have that in the background for the video. So then that would, if it rained, we have somewhere we could duck and cover if you had to, kind of thing. So that's what I'm working on for it too, so. Okay.
While you're here, would you be so kind to explain to us about this extension of this CHIP special use case we talked about?
Sure. So it's been almost a year that you guys have looked at the special use 2023-02, right?
SU 2023-02 CHIPS project.
Okay. I was just making sure my memory was correct on the case number. So I need a letter from the commissioner stating that you guys, what you wanted. So, and with applications like that, when you ask for a renewal, it has to come from the applicant. The applicant in this case is the Coffee County Commissioner, so I would need documentation from you guys stating if you wanted to extend that special use for another year. So I would need that before Monday, so I can put it with the motion for the extension.
Okay.
Says you need a letter no later than May 29th at noon to
Yes.
get a motion for the clerk for the June 2nd meeting. Is that
Yeah.
right? Okay.
So I need a
I
letter.
think we should do that then, I mean.
Would that just specifically be straight at the chips factory, or what we
It's just
discussed?
for that special use,
Just for the Bailey
just for the
property?
for the property that you bought for the chip, that the special use was put on that 200 and plus acres, that old Highway 50 and,
75.
yeah, 75
Yeah.
acres.
But it wouldn't be for anything if we changed it to industrial sites or anything
So-
like that?
No, it would not be. So, when it was originally approved, you guys put a industrial zoning district on both of those 200 plus acres out there. That stays with the property, okay, regardless of what happens out there. But then you also, on top of it, so you had to layer on top of it something else, because a chip plant is not an agricultural use. I cannot outright permit you to have that on your property. So it went through all the hearings to allow us to have a chip plant with EMS, daycare, the parking, slots it had, which was a lot, and I think that was it. And then obviously the chip park piece. So when it comes up again, I just have to ask permission to be able to extend it or not. If we don't extend it, then it goes away, and you just have industrial property sitting out there.
Because it was just zoning for that specific legal
Correct.
location.
Correct.
It's not for anything else
Correct.
countywide whatsoever.
So then I'm just asking for those two pieces there, your permission to extend it for one more year if you feel like we should or not. That would be your
I
decision.
think we should at this point.
So,
Especially if we have Dr.
Wyatt coming here next week.
Right.
then later on, since I'm up here, just to explain the process too. So say for instance, it doesn't go in the capacity of saying too, there's no daycare, there's no EMS, there's, it's just a small building, and they're only gonna use, let's say 20 acres of it, just an example, getting sample. Then the other 180-ish, you could do something else with. So say for instance, another business comes in and they wanna do a manufacturing thing for plastics, for example, just an example. Then you could apply for another special use for the other acres out there for that plastics plant, kind of thing.
Because we have had some interest from SSM, so we need to renew this. I feel like, I mean, they have some interest in a plant.
And of course, there'll be plating too as well that hasn't occurred yet. So in the plating process, you guys would also help determine, like, they want 20 acres, then you're gonna set aside the other 180, maybe you wanna do 10 of it for one piece, 20 of it, whatever it is. And then on those different pieces, you have legal descriptions on them, and each legal description you could potentially have a different special use case on, because they all have different legals. So yes.
We won't be tying it up for a year, just waiting on the chips factory.
So for the 200 plus acres, if you're tying up the special use properties, it would be up to, it would be to a year. But once the activity starts, like once the plating starts, once all these balls get rolling, the special use would stay in effect, and then it would go into the permit for that specific site time frame at that
But
point.
up to that point, though, it still hinges upon what the chips does.
Could, but let's just say 3 months in, and we have interest from another entity, could we apply for zoning for 30 acres on the other side?
You need to finish out the special use conditions on that chip one first. So there was a letter from Wholesale 12, which we're working on. You have to do plating and then meet sanitation. So as long as you met those requirements of that special use, you could allow the other pieces, because you have to plat it, to be able to apply for another special use on those. But you have to finish the first one you have on those to get it to that point.
I would be more apt to be in favor of that if we shorten that time period to say 3 to 6 months.
Or you guys decide how long you would like to see it for. I was just doing a year because the regulations say that I can ask for up to a year.
Sure.
But in that letter, you just tell me you want 6 months, you want a year, whatever your
So
thing is.
if we did it for 6 months, no reason we couldn't extend it if we had reason to be hopeful at that point.
Correct.
Correct? So that would be better.
How many times can we extend it?
Right now, infinitely. The regulations do not state a drop dead on how many times you can extend a special use. In the process of looking at the regulations, the board is in talking of possibly making it only 2 or 3 extensions after the original, but that hasn't been set in stone yet. That's what they're talking about doing. So you don't have this sunset clause of keep renewing, and nothing happening. You tie up the property, infinitely, that nothing occurs on. So.
Yeah, but if we're renewing it, then we're showing interest.
Correct.
The controls here.
Yep.
But then if we have another company that comes in that shows a great interest and it's tied up, and we can find something, I'd hate to lose somebody because we're waiting on somebody else.
Right.
If we have a shorter period of time, I think that would be valuable.
You guys, whatever you put in the letter, I will make sure and bring up the motion for that recommendation.
Other than some more paperwork, maybe 3 months is long enough.
I think that would be, I would do with 3 months.
Yeah, I mean, then we can always, if we can keep extending it, because, we don't want to hinder another possibility.
Then
So I'll watch the time frame. So whatever you pick, you put in that letter and I can put it in the motion. So.
But we need this before next week. It needs to be done this week, right?
No, next Monday is I'm on the agenda for next Monday. Next Monday is your last meeting before it gets approved.
Okay. I thought you said it ended at the end of the month.
No, so for planning purposes with the clerk, I need all the documents to be able to have it for them, for the books for you guys.
And next Monday, we also have Dr. White coming in.
I'm after Dr. Wyatt, though, because we wanted to hear him first.
Yeah, I'd encourage Heidi to put her topic on after Dr. Wyatt so that you could hear what he has to say, and I think it's going to be Dr. Wyatt and a representative of GS, I think Garrett Nordstrom will be here as well. In your letter, I'd encourage you, if Heidi thinks it's okay, to say up to a year, and then after you hear the pitch from Dr. Wyatt, then you get to pick 6, 3, a year, and I don't know what that'll be, because I don't know what he's gonna say. I have an idea.
Up to a year would be fine, then it doesn't lock you into 3 months, 6 months, or a year.
Okay, well, that sounds good.
FYI, I mean, we are waiting to hear what Dr. Wyatt's going to say, but there is, to my knowledge, another CHIPS application that is in process that has not been told no from another company.
Okay.
I mean, Dr. Wyatt is TEM, and just
So then it would be your
want to make sure
decision,
everybody knows that.
your decision after that, so the letter could be up to a year, and then after you hear Dr. Wyatt, you guys would have to decide 3 months, 6 months, or a year on, how long you want, if you're wanting to still extend it at that point, and how long, so.
I would say we just table it until the next meeting.
Yeah,
Until after Dr. Wyatt.
And unless something changes, I won't be here Monday, but, you know, that I'm agreeable with that. 3 months, it's not that big a deal to come back and do it again. I know it makes another paperwork for you, but we've got to try to keep things moving on this as we possibly can.
It's your decision now, so.
Even with 3 months, you're not gonna see anything happen up there with infrastructure, roads, or anything, so.
No, but you can see with paperwork, though, correct?
No, we just got to maintain the zoning, though. You know, we'd have to go back through that again.
So we don't let anything lapse.
Correct,
Yeah,
yeah. And I wouldn't let you do that. Just,
Okay.
I wouldn't let you do that.
So does anybody here know anything about this other place that's got an application for here?
Well, I just, they haven't been told no yet.
But I mean, does the county know that they're applying to build here?
There were, was it 5 companies that were originally part of the consortium? TEM was one of them, and there's, I think, 4 other companies.
I've got a bunch of files in my office with some more information, if anybody wants me to dig through some of that.
So, E&P filed an application, and I think they filed theirs first under what my understanding was new technology, and Carl can probably correct me if I'm wrong.
I think they were the largest too.
And that was the initial wave, and then they opened it up to another tier of applicants who were not in that direct initial wave. And it's I think you're talking about the second wave.
Yes.
Who are maybe a different part of the semiconductor stream. The initial wave was for actual manufacturing, and then a little further on in the stream were these other applicants.
I think it was the packaging.
And the suppliers.
So maybe what I can do is do this.
Well, I'm just concerned we put out to the county the chips factory application is denied. But then all of a sudden
It was,
we got another chips application. It's passed.
The grant application by TEM was denied, not the entire. There's other companies involved in it too. Yeah, I know everybody lumps everything into one thing, and that's not the case.
So you got on the agenda then?
After what time?
Is that your joke of the day, Ronnie? Oh, and while Wade's looking that up, I did want to mention too that, not next week, but for the following week's meeting, I did invite Craig Van Wade from Department of Commerce to come speak to you guys via Zoom. After that, that'll be after Dr. Wyatt comes, and he wanted to just talk about like other things going on with commerce and potential, infrastructure funding and stuff like that. So I thought that would be good for him to talk to you guys too. All the things.
had that list downstairs of all the applications, but I'd have to go down and sort through mine.
I can't remember specifically what the name of the company was.
Well,
There was like KSM.
there was a KSMC, which was the total group.
Yeah, that's the group, and then there
Yeah,
was,
the TEM was part of that, and there were some subsidiaries, that was part of that. It would have had smaller buildings, smaller functions to complement what was gonna be done with the GAN building. That'd be the gallium nitride building where they was making the chips, and then some of them was cutting, what they call cutting, some of them was packaging. And then, I can't remember necessarily what the other ones was, but there was, KSMC was the total group, and there's an alphabet soup there that goes with it for the acronyms of the other companies.
So they're all piggybacked off of one another that it went through.
Yes,
And
because
there's-
that's what was encouraged at the very, very beginning.
Yes,
I
I understand.
emphasize the beginning.
I think TEM had the largest, like the larger application. There was a lot of infrastructure that was going into that cost of the funding.
The buildings, TEM's building was the major cost because of how they have to have a controlled environment, which they work in. You getting close to it, or do I need to go down?
Do you know where that, so I was looking for the,
It was one of my emails I sent you, the list in there.
well, the KSMC page that has everybody, did that get taken down?
Yeah, I remember seeing it, but maybe
I've not looked at it in a while.
it's been a long time.
It had your picture on it.
Yeah, I was in there. Probably what scared them off.
Get into that.
I can go downstairs and get my information. There you go. Yeah. There it is.
That's where,
That's the ones that was made up, the original group was the ones you had at the top. Scroll back up.
it's not. It's like it's been,
Are you just looking for the list of who is in the KSMC?
no, there was a web page that had
That's the original group was this right here.
Rusty
I think I have
Electronics.
the,
Yeah, that was the original.
I think I have probably that printed out in my office, the same information if you need it.
The website I was looking for, I can't find. Okay. So,
You guys want me to go get that list, or?
If you got it, that's, I think it's, if it's there, but the thing, if we're dealing with time structures and permits and things like this, and all of a sudden, some of us know, some don't, that there are people that are involved in it, and we go put a 3-month end on it, and we cut somebody out then, that's not a good thing. So, I think we need to see where all these businesses are, and where they're standing, or if they backed out after the first grant was denied.
and TEM had the largest, they would have required the largest space. The other ones would require near, so I'm sure there'd be acreage available there.
I wasn't aware of that.
You weren't aware of that?
No, I wasn't before I got in there. I thought it was 1 grand, so.
I'm just.
Look at you, knowing that, Mark, so.
Yeah.
yeah, the application with ENP, I know that the county was a partner in that. The additional applications, I'm not sure what, if they're individual applications, that what the county's role and part in those applications is. I think, my understanding was the main application that involved ENP, TEM, involved the county, because the county had certain requirements and responsibilities. For example, the infrastructure and then tying into different commitments, but how the county plays into the additional applications regarding any of the sub-players, I'm not sure. I understood there were additional applications that would potentially piggyback off the original main application, but how those tentacles interplay, I'm not exactly sure.
Is there any way we can find out? I don't know who could or.
Yeah, I was supposed to talk with SSM on Friday, but they didn't get a hold of me, so I actually was gonna call them after this meeting, because you guys wanted an update on the SSM building, and I think also I was gonna ask about their application, because I was told that they had an application as well.
I know, they don't, it's my understanding, they do not have one as SSM, because SSM is independent.
Right, it's probably under.
However, I think
REL.
some people involved with the company.
You're probably right. I've still been learning all the intricacies in my 1.5 months that I've been here.
Well, if you find anything out on that, can you also see where we're at with the MP?
Yeah.
Because I've noticed that they were keeping that facility locked. Now it's opened up. The gates aren't shut.
Okay. I can check.
Where's that?
That's the old Dream Homes place there in Layville on the
Oh, I see.
highway.
Okay.
So this isn't exactly what I was looking for there. So
That's a lot of the company.
KSMC was the original, there was a page that talked about KSMC, and it had sort of an introduction and all the people who were involved. I don't know where it went, but these were sort of the sub-layers to KSMC. Those were the entities that were the tentacles that sort of branched off of the original TEM. So here's TEM right here. But all of these other ones were somewhere in the different stream for semiconductors.
I think we need to find that out, because we don't need to be shutting somebody down and all of a sudden we're in a lawsuit because we kept somebody out we didn't know about. That causing heartache.
Yeah, I don't think we're in that spot. I think if if KSMC continues on and somebody has applied and they, similar to EMP, was partnering with the county, then they need to keep the county informed on
Yes,
what's happening as well as a part of it. If the county is a part of an application, in any way, the county needs to be advised on what's happening. And that's probably where some of the confusion is, because the main application involves TEMs, EMPs.
Todd, that's this folder for all that we just started.
You started or we did?
Yes.
Yes. Okay.
Is it a good time for what I'll call the good news, bad news update?
Well, sure.
Can you give us the good news first or the bad news?
No, they ain't very good.
Depends on what you want. So the good news is the Maribel's building, the roof is,
In the works?
it's in the works, and both Mike and I were up on the roof last Wednesday. I think Mike was up on Tuesday, and it's gonna be a really nice roof, 30-year warranty is from what I understand. Is that right, Mike?
I believe that's correct.
But
Eventually.
In all good news, I guess not all good news, in some good news comes some bad news. The bad news is, once the roof was
Opened up.
and you got to see the belly of the beast, some bad news was exposed. That bad news is, if you've driven by that building, there's caution tape and barricades out front. That ties to the bad news. That is as a precaution, not because anything is imminent, but just to be on the safe side. So I have some pictures. That are probably tell a better. So this is on the roof, standing on the west side, looking east towards downtown. And what we have here is, this is the deck, and this is the front of the building, and there's a slight curve in this area. So I don't know how old this building is. It's got some age on it, and as you'll see in the next. This is the work being done. Several different shots. this is the brick facade, and it goes from, what, 4 feet up from the deck? Is that a fair?
Pretty close, yeah.
The brick, just over time, has deteriorated, weathered, worn out, and this needs to be addressed, is the best way to put it. So, I don't know how to best describe it, but someone's gonna need to come in and either tear the brick down to the deck base and then build it back up, or figure out another option to put something else from that 4 feet up, just to have some structure there. It's got a temporary fix until we could get this in front of you and decisions could be made moving forward. But based on what it looked like and what was described to me, I immediately made the call to the city, and the city came out and barricaded it off. Not because it's in jeopardy of falling, but out of an abundance of caution. And in my mind, if you don't do something and something happens, then the county's put on notice. Is this necessarily what anybody wanted to hear? Absolutely not. I described it as watching that Tom Hanks movie from years ago, The Money Pit. That's exactly what this has been.
So basically what's happened is that facade there that you see on the left side, you can see it's got a heck of a bow in it. It curves out towards the street, but the mortar in it between the bricks is just old. It's been there a long time. You can actually grab that parapet wall and move the whole thing physically.
Pin and tucking it, letting do anything?
It's possible.
What about taking it off completely? Is there anything structural?
That was an option too. There is a steel beam lintel down below there that's sitting on, which Wade and I talked about the possibility of just coming in, removing that, and then coming in and stick framing a front. And then the topic of discussion was brought up about the cosmetic appearance of it, if we wanted to try to maintain the looks of it, or if we just wanted to stabilize it and go from there.
So from the level, at the level of the roof, is the wall stable there, Mike? I mean, it's the area above the roof.
Correct.
That the issue is.
Correct.
The brick seems stable below that.
Correct. So.
But didn't it look like the facade on the west side had been addressed at some point in time? This one.
Yeah, it had been tuck pointed or something, had some work to the west side of the building, but it looked a lot better than this one.
The west building, you might say, is in way better shape.
Yes, so the west one's not really the concern, it was the east one that was.
Okay, so luckily it's not the whole front of both buildings.
Right. So I do know that Colin told me that whoever he called to see about tuck pointing was supposed to be here this week to look at it, to give their perspective about what or how we could deal with it. So kind of just waiting on him to get a good starting point how to fix this.
Yeah.
But they wouldn't tuck their liner up to it because, like I said, the whole front of it's loose. So they won't warranty it if they do put it in there. So
I understand.
Like Wade said, it wasn't a pleasant surprise.
Right. Well, if what kind of a cost we'd be looking at, but if the other one seems to be stable, cosmetically it'd look a lot better if it could stay up there at that height, I guess, wouldn't it?
Well, you could still, if you had to frame a wall in there, keep it up at that height even. So it's just the front of that building has staggered bricks. Somebody took some time when they built it to really make it look decorative on the front. So
I see.
that's kind of what we got into about it. So
And this is the whole run right here, so you can.
Yeah, you can get a pretty good glimpse there of where them two buildings separate.
I see. So the roofs are not separate, between the two buildings are not separated by a wall then, that's,
The roofs are separated. There's a fair-foot wall that runs down the entire length there. Yeah, right there,
You can kind of see it
from front to back.
okay.
So essentially, there are two roofs.
That's what I didn't know, I'm not familiar with
Yeah.
any of it. Okay, but it's okay.
Yeah, that one going down the middle looked pretty good, except for needing a little tuck point, wasn't it, Wade?
Yep. Okay.
I mean, structurally, the one down the middle is adequate. I don't see a problem at all with it. It's just that frontage, that fair-foot wall in the front that's got the
On the one building.
Yeah.
And if I remember right, the deck for the roof outside of one small section was in good shape.
That appears pretty good.
Yeah, it's pretty solid.
Yep. So, like I said, good news, bad news.
Well,
And I'm guessing they got that covered back up. I've been down there since it rained, so I don't.
Yeah, I assume so. And it's probably good they got it done when they did.
yeah.
So,
Like I said, I'm just kind of waiting for the mason to come look at it and give his thoughts and then
Very good.
figure it out.
You know, when you look at it from the front, I was just looking at like the Google Maps, it seems like the building on the corner and then those two buildings are kind of the same height, and then you've got the taller building to the right, and then the one to the right of that is lower. So it's kind of a mixed anyway of height.
it's probably what would be the most cost-effective approach.
Yeah, and a lot of them buildings downtown, they get on the historical register and you can't do anything with them. Or if you do, they gotta go back originally like they were. But I don't have any thoughts that one's on any register of any kind. I don't think there's going to be any buildings. Just the old Plaza Theater is the only one I know.
Right, when I talked to Pam, what she said on that one is they don't have to put back anything that was already taken out original, but they have to leave the original stuff that's already there. They can't continue to take out.
Once it was put onto the record.
Yes, and most of that pertains to the front.
That's it.
But like I said, I don't think that's gonna be a problem. I don't think that's on any registry.
Okay.
I would see if we've got a mason coming in, have him look at it, give us the best idea. We could pin and tuck it, and it'd be structurally sound. For the aesthetics of Main Street, that might be the best, but if it's gonna be a ungodly cost,
I'm a firm believer he's gonna probably have to remove all that.
remove it and
Reinstall it.
put a facade from the steel plate and
Correct.
set it up there a little bit.
Yep.
That might be, probably cost less than pin and tuck, because you're gonna have to dig a lot of old mortar out of there.
Yep.
You get that sway out of it.
And even if he does dig the mortar out, it's still got the bow in it.
Yeah, I don't think we would structurally sound have a bow like that in it.
Yeah. If I remember right, that building was on fire there many years ago.
That
My
might
flower
cost.
shop. And
Well, thanks for you guys' help on that.
sorry, Wade couldn't have offered better news.
At least I have pictures to back it up.
Forget to get something done with it before something else happens.
It's always something, yeah.
That's a given.
Like I say, that was a first for me being in a suit and on the roof like that, but
You shouldn't have to crawl underneath, right?
That's not what you normally see on the roof.
first time for everything.
I think he had them old boys up on the roof concerned, so.
Steam pipe shows up, something's wrong.
That's not good, is it?
we'll let you know in less than a week what they say. Carl looks like he's isolated a piece of paper.
It's SSM, it's semi-secured and it's for packaging. It just says on here that they're eligible for a ITC eligible. I don't know what ITC is, I just grabbed it and went. I didn't look up, if you guys were meeting this afternoon, I'll go down and look it up and see what it all is with their application. But it's, there's three from the state of Kansas. There's one semi-secure materials manufacturing for packaging, and Integra out of Wichita for packaging. And then there's one out of Manhattan, radiation detection technologies, and it's an extension of whatever they have. I don't know who they are.
It sounds like they're all piggybacking off of one getting in there.
Yeah, at that point in time, yeah.
Yeah, except for Integrity.
I'll just look for you, Laddie, then.
Okay.
Okay, thank you.
Appreciate you coming in. Thank you.
Happy day.
Purchasing policy. Any members think that one can
Carly, how exciting. It's nice sitting here, you just, what's going on?
these good ones?
Yeah, yeah. Just wouldn't want to flop them on top of that.
Okay. Grab one here.
This is all of that stuff is in.
Did you have something for the pay app for Jessica?
I need to print off that.
Todd, here's a basket for you.
Okay. Thank you. And that's for this file here?
Yes.
Okay.
Jessica said she leaves at lunch or leaves at noon for lunch, so if you need her to special issue that,
I'll go do it.
River City thinks she needs it.
I'll go print.
Okay.
That old Barb's always got such a good attitude. Happiness on her receipts. She's so joyful all the time.
guys are done signing, I've gotta go deal with the law enforcement issue. I need a 10-minute executive session to deal with non-elected personnel. That's number one. Number two, the last part of my roundtable. I know in the minutes they've gotten a little more expansive, and I'm recommending that if you're gonna add more than what originally was in the minutes, that it just be a placeholder. So for example, when I brought up the CHIPS application denial last week, I'd recommend that minute topic say county councilor address CHIPS application, then basically a statement that it was commission updated the EMP PEM application denied, period. And the benefit you have here is anything that's talked about or discussed, unless it's executive session, someone can come back and roll the video and play it.
Right.
I have there's legal reasons why that's my request, and that it just be limited instead of someone trying to keep up and give a play-by-play of what's said. I don't think that's necessary. It's not legally required, and
Right.
you can override my recommendation, because they're your minutes, but that's my recommendation.
I feel the way he does, and I was the one that brought that up. I wanted the subjects that were discussed, just the topics, somehow, where it is mentioned in the minutes that so-and-so, there was no action taken on it, but it was in the minutes. They see in the minutes, they can go to the video.
Right.
Instead of a play-by-play. And we even talked a little bit about that, because I've seen some Lane counties, for example, oh my gosh, they've got a novel. In Leonard Anderson, it's really, really, really detailed. We don't need to put that pressure on somebody trying to do that, and then,
Yeah.
so,
Yeah.
I feel the same way that Wade does.
I was in agreement with your initial thought, that put a brief summation of that we discussed something and leave it at that, probably.
So you just work on it as far as tweaking it, and, I mean, I can see some things there that, probably don't have to.
Just here for the ride. But I'm just here for the ride.
I gotcha.
Going back in time, things were very detailed at one point in time, and then some action involving the county illuminated minutes at that point in time, and the recommendation was at that time, and it was my recommendation, that they go back to being bare bones, and that was intentional and for a reason. And part of the reason why too was because people would go to YouTube and watch the meetings. So I just wanted to throw that out there after I've kind of been watching the minutes and seeing that they're getting a little more and more detailed, and that's fine, but it can lead to other unintended consequences. So,
Can you explain to me what a bundle is?
a bundle is
Bundle of funds.
is that for,
$500 to purchase 25 bundles
yeah,
for the Department of Transportation.
so that is with diversion funds, and that's being purchased to help assist, let's say somebody is released from the Coffee County Jail who is not from our local community, and instead of having that individual wander around trying to find a way out of town, I'm purchasing bundles for Coffee County Transportation to help assist them in relocating to wherever they're trying to go outside
To
of.
where they need to go.
Right. And a lot of the people who are released, they've been incarcerated for a period of time. They're either transients or from some other community within the state, and they don't have a ride, they don't have a job, they don't have any money. This is a way to bridge that gap, and as long as they communicate and get on the schedule ahead of time, they can turn in a bundle for whatever it is and have transportation out of the community.
So if something happens like that, they are released, do they get a hold of the sheriff's office to get a bundle, or how do they come up with?
We're still fine tuning that, but the first initial step was figuring out how to get access to
A ride?
the funds from time to time. And there's some community resources that help, but this was trying to be creative and having a way to do it and not put it on the shoulders of the taxpayers. So diversion funds.
Oh, so it was paid out to your diversion fund? Okay.
Yep.
Sounds like a good idea.
Yep, if you looked at that email is me coordinating with our local probation officer to also help, if somebody has a requirement, for example, that they have to get a mental health assessment or something as a condition of probation, but they can't do it here, then I'm gonna get that entire bundle to our probation officer who will have access to it and then can utilize it, deploy it, yep, as needed.
I just wanted to share some information with you guys. I went down and got on that SSM application. What it is for 20 million they put in for. And this is what they're eligible for through the CHIPS Act. Is that ITC that give you some alphabet soup. That's a quick app.
Okay,
That's all.
thank you.
So when you hear that, I hate just to leave you
How much
open on
was
the
it
alphabet
cost?
soup.
How much was it they put in for?
20 million for 60 jobs. That's for a building. It was just real brief on the side.
This is the IRA money that.
This would have been out of CHIPS Act.
CHIPS Act.
CHIPS Act. I don't know all the great details of it. That's just a very, very brief thing I could pull down for general information.
Thank you, Carl.
You bet.
Thank you.
downstairs, thought maybe you'd turn it in. Okay.
chair in your office up.
Brad's in there, he can handle it.
He can handle carrying it.
Yeah,
For sure, he's the chair up.
Instigator.
sometimes a little of both.
Looks like he's running to the door. Yes. For a lot less.
Before I have Brad pop in here, do you guys care if I go ahead and do the roundtable that Angie has?
It could be fine.
She was contacted by someone about if we are wanting, the pool store out of Emporia to open the pool at the former Bailey property again. It looks like last year it was $682.42 to open it, but that also included an automatic cover repair, so I don't know if that would be another issue this year or not.
Should be less than that, you would think.
The cover repair last year was $110.
Okay.
But that included the water fill, the chemicals, and the mileage going there to open it.
Well, it's kind of been the opinion that we were scared to let that pool get out of condition. I hate to keep spending money on it, but
They called me and, they wanted me to give them, that's not my decision. And I told him to talk to Wade, and Wade had a little bit of information about it, but I think you don't, I always hate to say it, if you don't take care of it, if it sits there, you can have more problems with tools. If they're not taken, or used, they're older.
Yeah, they get out of condition, it'd be really expensive to get them cleaned up.
You get a liner cracked or cement cracked somewhere, because they're not,
Yeah. So my opinion would be that we need to continue doing that, I guess. So we know that it's getting done, that was the idea.
So it looks like last year we used Jack's Lawn and Pool Store out of Emporia.
I think that's who called me.
We just will keep using who we're using, they're familiar with the situation would be my thought, so I don't think we need to take any action to do that, do we? I mean, everybody seems agreeable, so.
Just give them the okay to do it, I would think.
Okay, I'll let her know.
Okay.
Thank you.
Is that all she has?
Yep.
Steve Brosma. Wasn't he with Geotech for a while?
He's a surveyor.
Yeah, he owned Geotech for a while.
Yeah, well, that's his company.
Well, it got bought out
He did.
about a year ago. Somebody out of Manhattan.
So is he doing work on this?
Yeah, it looks like he's independent.
Yeah, it says that he's past president of Chiefs.
There was one in there that was questionable.
Oh, yeah.
That one there.
We gotta talk to him about 5 or 6 weeks ago.
When is that?
Labor Day weekend. What is the Wolf Wash? Do you know?
It's a car wash in Lebo.
Oh, it's in Lebo?
Yeah.
Okay. They got a dog wash station?
Yeah.
Really?
Yeah.
And they got an Osage City, Kansas address on it.
Yeah, they live on the other side of the lake, the people that own it.
Okay.
Dog wash and where?
Probably not like automatic, like they'll run
No,
them through.
I mean, like, bull
Drag 'em
dogs,
through
yeah.
the leash.
It's real cool, you take them in there and there's a pan you put them in that's big and it's up here and it's got like a kitchen people that do that,
Sprayer
got
on
that, and here you can turn it for pre-wash, soap with flea and tick medication in it, rinse, and then they've got an air hose where you can groom them with that. My dogs go crazy when you turn it on.
That's not their part of it today. Go ahead.
Isn't somebody putting one of those up there behind?
I think the Kings are.
Yes.
It's useful.
Where? I'm sorry. Right behind the liquor
Yeah.
store?
Oh, wow.
I know the city set a meter in there specifically for that. Yeah, they're building a dog wash station behind the liquor store. That's
King Liquor.
Oh, okay.
right across from Subway.
Oh, okay.
I think that's what I heard. Is that so right? We do not bathe our dog at home because she sheds too much and that would just clog all of our plumbing.
Have more problems.
Yeah.
Where do you take it? Car wash?
Carmen, gentlemen.
You go to the Wolf Wash and let it be their problem.
Yeah.
Air conditioning in there, just nice door shuts behind you so they don't run out. Have a whole thing of towels and stuff in there for you to use.
Really?
We take her down to Carmen and she gets to have a little play day down there and she loves it.
It's cool.
Yeah, and then I pick her up and she whines coming home like,
I want to go back. Huh.
I'm like, well, that makes me feel great because I missed her and she didn't miss me.
Yeah, she needs you to pay for the vacation, so.
Yep.
Are they still working on this one here? As far as I know.
Yeah, I think so. I think the beginning of this next one is right there.
We're almost done.
Okay. Yeah.
Yeah, because most of that one was this contract.
Guess we're just waiting on Mark now.
Is that the last one?
Mm-hmm.
These are part of the next one. All right.
These are all car washes.
This isn't part of this.
No, this is the payout for River City.
Okay.
I think this is.
Yeah.
That was part of the other one, was it? That was part of the other one, that down there, was it?
Because the mouse match up here,
Okay.
so. Yeah, they're all matched together, so.
Okay.
I think Tom's got the last one for that basket in there. Start some more figures.
That's the only, there's some sprinkles, this one is nothing measurable.
Got a quarter of a trace.
Quarter of a
Good.
trace? So I guess you guys ready for this basket down there then? Yeah. Second?
Let's toss down that one there.
That's the last of that one, huh?
There's your new basket. Rainfall data logger and collector. Put up here for my radio and my for the landfill. So, two of them. Landfill. Did it? Yeah. So, it was shipped to landfill, right?
Wade, do these all need to be inserted somewhere, or?
They kind of get mixed up, I'm not sure.
Yeah.
Nobody's ever tried to keep them in their spot. I think it kind of, they use them when they're putting them in there, I think, but.
Are they no different departments, have different colors, or?
I have no idea.
We've never had any complaints, I just put them back
Or
together.
you've never heard it.
Yeah.
There's the end of the table now, it's Todd's problem.
Well, it gets, when, you know, to do that, you might need to keep everything upright in the same stack and,
Yeah.
and it just gets He'd get pretty,
Pretty much impossible.
he'd get screwed up anyhow, I guess, is what my thoughts are, even if we tried, I'm afraid. And that was what I've been told, is try to keep them in the right baskets, that's the.
Well, Casey handed them out, so that's where I'm going.
Yeah, yeah.
Just kicking it
I
on down.
just gave the basket to you, you handed them out.
Okay.
Technically Ryan started it. He brought
That's
the
true,
basket in.
that's true.
And once Brad gets in here, you just let him.
Okay, I'll go for that, okay.
Compelled to join.
Welcome. You were feeling the need?
Trying to not cough. It's not working. Have you had anybody's file for office this morning? I have not. You're probably get a flurry of people at the end of the week. Maybe not. Take them as they come, if they come.
You got that new grandbaby here a while back.
Yeah, we did. Keeping his big sister until last night. That's been a lot of fun, a lot of work.
A lot of both, huh?
20 months old's just almost fast enough to get away from you now.
Yeah.
How old? 20 months.
I'd say,
Old enough to start getting sneaky. I took a picture of her in a car seat. She looks like Colin because she's so long in this picture. She looks like she's from Lebo. Looks like my dad when he was. Yeah.
Oh, yeah?
My grandpa before him.
What?
And it's another one of those.
Oh, my granddaughter just.
Oh, she's a cutie.
She looks like my dad did when he was a year old. Understand we're finishing signing and then for Wade.
Yeah, we've got an executive session and then the balance of round table. She already gave us Angie's round table.
Tracking in waiver voters. For the first time in 2 years, they allow us to do list maintenance. Figure out where all these people that aren't here anymore went.
I see. So you have a lot of them that are inactive, that are gone for whatever reason, huh?
You right now, because we had so many elections last year, we didn't get to do it last year.
I see.
They restrict kind of when you do it. But ordinarily you do it, and we didn't have time with the presidential program last year.
I see.
So it kind of piled up, we're at hundreds and hundreds now.
I see. So a fair amount rolls in and out then. A fair enough number roll in and out then.
A lot of young people in there, we moved away. Some of them use something. Main thing is, it's easier to try to get people current than to show up mad at the polls and to vote provisional and not get counted and that sort of thing.
I see.
Not expecting Don Small to come in and get on to me for not having cleaned up enough. Don was very particular about keeping after clean voter roll.
I see.
There's one that ran through earlier that had a balance of 5 minutes. Oh. Sorry. There's a 5 there that should be there. Yeah.
How many hours that entail, that's pretty so quick, ain't it?
Yes, sir, it is. There's a line drawn through that. Didn't explain what that
Suppose we quit paying them, they'll quit coming.
Well,
In some instances,
They
it
may-
might be okay.
They may just come down to get their money then.
Right.
yeah. Brad, look at it. Casey may wanna look at this. This bill says it's $594, but the paperwork that we got from media accounts is $94. Then the 94's crossed out,
Yeah,
so
it
it's
is.
$594. There's no explanation
On why it's on
for
there.
the
The girls probably understand why real easily.
Probably a Jessica question.
Oh,
It's from
okay.
Road and Bridge, so.
Oh, for Road and Bridge, yeah. Not this one. Let's see. See when the 500 comes from. Back. Let's call them down at Road and Bridge. I have to go call if you guys aren't gonna do anything exciting here for me.
Thank you.
Well, here, Brad, before you go, so this one, they got a ticket for $17.80 here, and then they got a $218.39 and a $53.98. And this ticket says $272.37. So they've taken and they've added those two together to come up with that. I don't see an invoice for the $53.98 anywhere in here. There's the $17.80 and $272.37, which is the sum of those two there added together. There's the $53.98 buried in there. So they bought two pliers at $26.99 each. And there's a $53.98. I wonder why they have it wrote on two different tickets here when it's on one ticket there.
Got that solved. You can call to Cheryl.
It all adds up.
Yeah, it all adds up, it's just how they got there.
Maybe somebody was adding it up and they overlooked it.
Well, are the invoice numbers the same?
Yeah, they are. So that matches.
Good.
just anyway, left them?
Yeah, except for these,
Okay.
just that pay app for the,
Jail.
yeah, for the jail.
United Rentals started at $163 an hour for labor. Rough. I don't wanna be in here anymore.
Well, I have you, sort of an answer is that they're basically saying that there's a couple of these utility things that they deliberately overpay in advance so they don't have to do the monthly late advance with them. I'm not sure if that's an appropriate way of doing that, but that's not my role to decide. So you may want to talk with Ryan, but that's what it is that's, they're just deliberately overpaying to create a credit balance so they don't get popped for late fees. Because the turnaround with our payment system
Okay.
creates.
The time our money gets there,
Yeah.
our cycle.
We're late every time by the time. So I don't know how you want to handle that, but that was the explanation.
Nothing has to do with standard, because you have to get I don't know, that'd be a question for them. I was just safety at the local stations, I mean, I can maybe, one of your basics on the drive. I would be curious though.
Disconnected from the whole world. What happened there?
So that's cable, isn't it? You can get, you can't get fiber. I don't know how they're set up down there. This is another one that I had to talk with him a couple months ago about, this ice. They're buying ice from last time was from Iowa or something. This is from Wichita.
Well, I just signed a voucher that fixed an ice machine out there. That fixed several ice machines.
Well, here's one for 200 bags of 7 pounds of ice. And a delivery fee.
I suppose they got the machine fixed now? I mean, I don't have any idea.
I don't know, I don't, they've sent that other one somewhere.
I asked him about a month ago, he said, because there was another ticket here from Ohio or somewhere a couple months ago, and it was for almost $300, and this is $340, and he said, but you guys have an ice machine out there.
Yeah.
I mean, there's $600 right there.
And they serviced on one day 2 ice machines here and came back and serviced another, charged an additional $150 service call. On the one that did 2 of them, they split the $150 between them for $75 each. Hell, that's what they've got going there. They can bomb.
Yeah, you wouldn't think that'd be more than they could have done in one day. You would think it would require 2 calls.
Well, they were turning on different dates, so.
Yeah.
Different runs.
Yep.
Yeah. Yeah, I suppose we'll have some overlaps like that that can't be organized, you know, to have two calls.
I did get it cheaper through Hooters too. If you want to deliver it yourself.
Yeah.
Probably wouldn't be too far to do, would it?
Depends how much you're saving.
I think I would be receptive of spending locally versus.
Yeah. Not spending it at all. Get the machine.
Hoovers may deliver.
Add it to our electric bill. Get the machine fixed. Add a little to our electric bill.
Water bill.
Yeah.
We got a meeting at 1. Okay. Well, that'll keep them happy.
A little booster in there.
Heidi said that she has a meeting down there at 1 o'clock. So if you're gonna do an executive session, you might need to do it here. I'll just say, yeah.
Okay, yeah, sure, we can do that.
She also would like to talk to you after the meeting. Something.
Do you have any chocolate candy you can provide us? Executive session?
I do not have any chocolate candy. The treasurer's office has chocolate candy.
The treasurer's office does?
Usually.
Perhaps a trip there is warranted?
Perhaps. You have to try to make it up to people. We're just nice and helpful, so we're not getting candy.
Go to some payroll check. Yeah. Maybe we could call Kroll's Delivery Service.
Listen for the call.
Yeah.
Thank you. Made it through all that paper.
They're closing in on it down there.
Quick.
Sure. Only works one way, I don't know why that is. Excuse me.
Okay.
Same last night.
Yeah.
Had to take a double take though.
Do what? Next, I'm thinking a few weeks on the list. Keep in mind, that was Wade's idea.
Wade? When you say Wade, there's two different Wades.
There was only one Wade I heard present.
You got Wade 2 and Wade with a Y is what the ladies next door refer to it. Well, what we want to do, you want to do your finish round table or?
Yeah, I don't, other than the executive session, I don't have any round table. Next week, you'll see 2 new job notices coming out of the county attorney's office for some summer interns, 2 undergrad students that are from the local area who just finished their first year at their different respective universities. I think both have an interest in the law, so they're going to hang out for the summer. And then, similar to last year, if you remember Ryan Peterson, he was here last year. He finished his second year at the law school, Washburn. He got his temporary law license, and he actually went into the courtroom and handled cases, was involved in a jury trial. Cale Johnson's going to come back this summer. He just finished his second year. Once he gets his grades back, and the grades are a trigger for getting your temporary license, he's going to come back and be here this summer to do the same thing that Ryan did last year. And then even going further, Washburn law school has a third year anywhere program, which is unique. It may be one of the only law schools I'm aware of that does that, but you can find a place where you actually want to work and get some hands-on experience. For that, your entire third year, you can go to that location and actually work as a practicing attorney under the supervision of somebody, sort of an extension on your temporary license, and he's going to come back this fall and do that for his entire third year, and it's up to 20-some hours a week. Also has to have classroom time. So I say all that to, I try to impress upon people anytime you have the opportunity to bring young people back and have them actually be a part of something like this here in Coffee County, or anywhere else for that matter. If they're not going to do it here, they're going to do it somewhere else. And getting that exposure to the local environment hopefully lights a fire and plants a seed for them to want to come back and stay here. And having healthy internship programs at the county level, I think is extremely important. And you have other departments, for example, economic development, once that's up and running, having some young people from the universities in Kansas or outside of Kansas that want to come back and see how it works in an environment in a county this size, I think is extremely beneficial. So that's my planting seed and the pitch.
We have a definite demand for attorneys and all types of young people in our county as far as that goes.
There was a commission that was put together by the judicial branch, and it had a number of attorneys and professionals from all across the board to study what they call the desert of attorneys all across the state of Kansas, and that other states, either North Dakota or South Dakota, has a program where the county will pay a certain amount, the state will pay a certain amount, and then the state bar will pay a certain amount to get people to come out and sort of do like what in the medical field, I think that they have this residency programs where you stay for 5 years and they'll pay for a certain part of your school expenditures. So somewhere down the road that might be something to consider, but that will start with interns. So I'd request a 10-minute executive session, myself and the board, it's not elected personnel, in the discussion related to an individual employee is, for lack of better wording, is HIPAA related. Obviously that can't be discussed in an open session.
I don't know how to spell HIPAA.
HIPPO. And I think for this one, I'm okay if you just want to stay here instead of.
Tammy said she's got a meeting downstairs, Heidi does, so if it's okay, we need to stay here. So, motion to enter into executive session for 10 minutes to include each of the 4 commissioners present and County Councilor Wade Bowie II to discuss personnel matters of non-elected personnel related to HIPAA matters under the Kansas Open Meetings Act, KSA 754319B1. Also moved. Barker seconded. Any further discussion? All in favor say aye. Aye. Motion carries. We will go in at 10.
Just flipped over to 8.
Okay, 109 now.
10 minutes.
Yes.
Let me hit save here if I can find it.
Thank you, sir. Here we go.
camera off. 109, I guess.
Yeah.
It was shut. When that time comes, you can reach back and shut.
It ought to be,
I don't see anybody racing toward the door.
there.
There we go.
There you are.
Let Brad back in.
There's no action taken in the previous executive session.
No action.
So, was that all you had for roundtable?
That's it for me.
Todd?
Mr. Peterson?
I don't have anything, I just mentioned the chip stuff, that's enough.
Yeah, yeah.
One thing I got is Wade and myself went down to Maryville's last week. Did had a couple that went in there that was interested in some items in there, some paper products, as far as the inventory, and I'm gonna get with them and see if they can come up and address their concerns instead of me doing it for them. And take it from there.
Okay.
That's all I got.
I think everything I was interested in was covered. I know we never did talk about our trip to Cedar Crest there. What's that been now, 2 weeks ago or whatever? You were gone when we did roundtable.
Yeah. What date was that?
It was a Monday night, but has that been 3 weeks ago now?
May 5th. So, going back in time, Jenny, Economic Development Director, Coffee County is a part of Team Kansas, which is an economic development initiative, and as a result, Jenny received an invitation from the Department of Commerce, Lieutenant Governor's office for a Team Kansas function at Cedar Crest in Topeka. She was not able to attend because she had a prior commitment, and she reached out to me to ask if if I was available and I would attend in her place. I didn't know exactly what it was, but I knew it was something that had to do with economic development. And as a result, I felt it important to have some additional county representation, because I didn't know exactly what it was, and it may be an opportunity to have a meet and greet with other Kansas County economic developers. So I got a hold of the commissioner, who in my opinion would be the first name that would come to mind, and then also the vice chairman, and asked if they would be interested in going. I cleared it with Jenny, who cleared it with Topeka, and had to get my name on a list with the KBI, or the Highway Patrol, not the KBI, because they want to make sure it's an invitation-only event. Make a long story shorter, ended up riding up myself, Commissioner, Chairman, and Vice Chairman, ended up going to this event, met with the Lieutenant Governor, the Governor, and there were probably 30 people there, sort of just a meet and greet. I think it impressed, especially the Lieutenant Governor, who seemed very impressed that we had board members from county government attend that event. It was very nicely done, and just talked about the positives for the state of Kansas on an economic development level with what Kansas has done, and what was it, the golden shovels that Kansas has been awarded versus other states, and that kind of thing. It was about an hour and a half total. And a good thing for Coffee County, a good thing for Coffee County to be a part of, and hopefully next year Jenny can make it, and whoever's in one of those seats can attend with her. I think, in my opinion, would be that's a good thing. Met with and talked with several other economic development people from different places in the state. One of them was from, I believe, Montgomery County, one from the Kansas City area.
Yeah.
And both of them were very, in the conversations I was a part of, very impressed to see that board members from the governing body were, felt it important enough to attend, and I think that speaks volumes. So.
Yeah, it was pretty interesting. Had some good conversation with some of these other economic development people. I think it's sure, we get somebody that ought to go from the board next year. It was worthwhile if they have it again. I assume they will.
So I apologize if you didn't get invited and you didn't get to go, but that was my evaluation and selection criteria. So if you're the chairman or vice chairman, then your first up on something like that would be my opinion. I mean, I wasn't even supposed to go, so.
Yeah. But I'm not much on the dress-up places to go, so I'm not very eager normally, but it was very interesting. I was glad I went after I went.
Glad you could make it with it.
Yeah. I guess I don't think I have anything else that we haven't touched on, so I guess we just as well adjourn then at 1:25.